Can you hear? Okay. Here server. Good afternoon. Your chats. Yes, yes. Mix देगा ना. Please join in. Can you start? Voice breaking. Voice. एक बार देख लेते हैं. Let's. Voice is okay or not? Please let me know. Voice, voice, voice. Once it will be the like proper flow, we will start. Okay, yeah. Doctor. Voice is not coming. Voice. Now voice is okay. Let me know. Hello, hello. My voice is okay or not? Yes. So we are starting sessions. We are starting the session. So this session is dedicated to the those who are beloved, like the हमारे साथी lost their life or they are struggling with their life during the Saket building collapse. Praying for them, and we are trying to as much. So hope, and those are the like not getting. They are not getting back to their flow. So will help them. And also the about these sessions motto is the like to recall all the things and to conclude all the which is the important one, which is the need to know, which is the like the things which is the really matters for your exam. So these are the important for the FMG and word exam. The concept is so it's breaking again. एक बार फिर से वॉइस ब्रेक हो रही है, थोड़ा सा पास ले आओ. Now I think voice is okay. Please, please. एक बार यार ये नाउ अभी वॉइस सही आ रही क्या? मैं 2-3 मिनट तक बोलता हूँ, तब तक अगर ठीक आ जाए था ना, है ना? So in the today's sessions we will discuss about the all important aspects of the like clear but low sound. Go down. Now okay, the voice. Hello, hello. Now okay, voice, everything is okay. Please let me know. Yes, then we can start. Once it will be in the flow. Yes, है ना? Then we will go in the like proper manners. Okay. Okay. So we are starting about these motto of these sessions. That is we want to like conclude all the things, and it's not about the subject wise. It's which is the very important one. I analysis all the things which is the PYQs which already asked in the FMG NEET PG, and I said, and I like make the metrics of these clinical cases and what is the possible questions which they can ask in the FMG exam. So that's why these questions are the very useful. So yes, let me start. So first questions from the just you need to, if I will give you the options, then it will be easy for you. It will not recall that much memories, because we want here to not to just mug up the things. We want to just recall and we want to like focus. We want to focus on the things, okay, which will be the helpful for your exam. So first questions, in that one I will take the brief, and then I will send you the annotated one, and unannotated already sent in the group. So we are starting the first questions. The child, okay, here is the main that things, which is the child with what? The cola colored urine, the facial puffiness, and they decrease the urine output. The parents give the history of the sore throat before how much week? The 2 week back. 2 week back. What? Sore throat. 2 week back sore throat. What is the diagnosis here? Please everyone reply so we can make it the more meaningful. Okay, sore throat 2 week back, and there is a, it's a like the cola color urine means it's a nephritic, not nephrotic syndrome. So cola color urines. And what is the diagnosis? Diagnosis, it's a PSGN. It's a PSGN. Okay, so that one we need to remember about the PSGN. And if there is a history, if group A beta hemolytic, the streptococcus, if there is a history 1 to 2 week, then it can be the strep pharyngitis. It can be the strep pharyngitis. But if the any kind of the strep skin infection like impetigo, they will give you the history or something 3 to 6 weeks. So it will be the PSGN nephritic. It's a PSGN nephritic. Yes, correct everyone. Dr. Wisdom, Dr. Rohit Khetawat, Dr. Ritesh, Dr. Abha Singh, Tanmay, Whistling, is Dr. AJ Pulse, and the Nestle Angra. Okay, that's good. So now about the PSGN, you need to remember for our FMG aspects and for the exam aspects, you need, it's here, it will be the low C3 and the CH50 will be the low. Okay, so that one we need to remember about the PSGN. And main things that how we will diagnose that sore throat before the 2 week back, and cola color urines mean it's a nephritic. So that one we need to remember about these things about the PSGN. Now question number 2, very easy one, but it's a they used to ask regarding the this questions, that is a cyanotic childs, and their breathlessness while playing, that is suddenly squared, that is a mean buzzword for the mean buzzword for this disease. That is a question number 2. And what is the answer for this one? That is suddenly squared down, that is a tet spell, and there is a ejection systolic murmurs. And what will be the most likely diagnosis? Cyanotic tet spell. Okay, cyanotic tet spell. Okay, cyanotic tat spells. And what kind of the shape you will see? You will see the boot shape heart, the boot shape of, that is a tetralogy of Fowlett. That tetralogy of Fowlett, what is component of tetralogy of Fowlett? There will be the overriding of aorta. First will be the overriding of aorta. Second one will be the right ventricular hypertrophy. It will be not left ventricle, right ventricular hypertrophy. Third one you need to remember, that is a pulmonary stenosis. Fourth one, it will be the what kind of the VSD? It's the VSD, boot shape heart, tetralogy of Fowlett, and there is a 4 component: overriding of aorta, pulmonary stenosis, and the right ventricular hypertrophy. Here the people making the mistakes in the, like the right ventricular hypertrophy hoga, left ventricular hoga. It is right ventricular hypertrophy and the VSD. If there is ASD involved, then it will be the ASD involved ho gaya, then it will be the like what, pentalogy of Fowlett. Okay, pentalogy of Fowlett. That one we need to remember. Okay. So it is tetralogy of Fowlett. And tetralogy of Fowlett associated with the one syndrome. Can you tell me what kind of the syndrome associated with this one? It is associated with the one syndrome which is the present on the chromosome number 22. Chromosome number 22 पे guess करो which syndrome? Which syndrome is associated with this one? Yes, it's a name start with a D George. It's a D George syndrome, where is mnemonic is the catch. What is the catch? What is the catch? ठीक है, ये भी कर सकते हैं. The D George syndrome. What is the catch mnemonic? The D George syndrome. The D George syndrome, it is associated with the tetralogy of the Fowlett. Okay, in the catch mnemonic, what is the catch? Catch 22. Yes. Cardiac abnormalities. That is a cardiac abnormalities. That is a tetralogy of the Fowlett. A, absent of what? Thymus. Absent is the thymus. Now T, absent of the thymus. What is the T? Thymic hypoplasia. Okay, thymic hypoplasias, that abnormal faces you will see. Yes, also there is a faces, and the T you can see that a thymic aplasia, and A will be the, you can see that abnormal faces. What? Cleft lip, cleft palate. Okay, abnormal faces. And the C, cleft lip, cleft palates, cardiac abnormalities. And what? S say hypocalcemia. So patient will be the present with what? Patient will present with the bone pain. So that one we need to remember. The already PYQ, ये अपन को याद रखना है. ठीक है, कैच निमोनिक. So catch cardiac abnormalities, cleft lip, cleft palates, abnormal faces, that is cleft lip, cleft palate. Okay, cleft lip, cleft palate. If you will reply, then it will be easy to like the recall it for the long time. Okay, so that one we need to remember. The tetralogy of Fowlett's. So tetralogy of Fowlett देख लिया, बाकी वाले भी देख लेंगे. The TAPVC, which is the figure of 8 sign or the snowman. TAPVC, that is figure of the 8. That figure of 8, that is a TAPVC. So that one we need to remember. Next one, the figure of 8 sign TAPVC, that is also congenital heart defect. Now there is another one which is the agon string, that is appearance, which is the TGA. तो ऐसे याद रख लेना है ना. Transposition of the great artery, that is the TGA, which is egg shape. And the boot shape we already discussed, that is a boot shape, which is we already discussed, that is a tetralogy of the Fowlett. Now next one is Epstein anomalies. There are Epstein anomalies, which is the like associated with what? It is due to the teratogenic effect of the lithium teratogenic effect. Okay, teratogenic effect. Teratogenic effect, it's a lithium, it's teratogenic effects. Now about the lithium, can you tell me two important side effect of the lithium? That is a two side effect, and lithium, which is the drug of choice in the we give in the bipolar disorders. So this is a recent INSET questions about the lithium. The bipolar disorders where we give the bipolar disorders, there is a drug of choice is the lithium. But here is the hack. There is a CASA bipolar disorder. So the bipolar disorder with the rapid cycling, there is a drug of choice sodium valproate. But this is the sodium. This is the bipolar disorders where is the mood swing, that is because it's a mood stabilizer drugs. This is the mood stabilizer drugs, and there is a two important side effects. Can you tell me two important side effects? Yes, I've seen my box hai. Yes, correct. What is the two important side effect of that lithium? Two important side effect. Yes, hypothyroidism, hyperthyroidism, and fine tremors. एक और important one, that is which is the related to something diabetes से related. Diabetes से related. Can you tell me which one is the this one? Diabetes से related कौन सा वाला है? Lithium. And the rapid cycler bipolar disorder. Bipolar, there is a drug of choice is the sodium valproate. Sodium valproate. Now about the lithium, there is a what is the side effect important? There is a nephrogenic diabetes, ना torch infection, hypothyroidism, diabetes insipidus. कौन सा वाला? Central diabetes insipidus और nephrogenic side nephrogenic, that is a nephrogenic diabetes insipidus. So that one we need to remember about the lithium. Okay. Lithium, which is a mood stabilizer, a teratogenic effect, which is having the box shape heart. It's the box shape heart. ये ध्यान रखना आपको, ठीक है. पोलीयूरिया सिम्टम्स होगा ना. नेक्स्ट वन, कोर्टिसन ऑफ aorta, that 3 or E sign, inferior rib notching, that inferior rib notchings. Okay, you can see here the rib notching, that is a figure of 3 signs. Can you tell me that is this is the cortisone of aorta, which is associated with the one syndrome? Can you tell me? Okay, I'm telling you about this syndrome. Can you tell me about? I'm telling about this syndrome. That is this syndrome, which is like the patient will be having the no bar bodies, and this is the woman which is having the normal IQ, but there is a sealed chest, but there is a sealed chest, webbed neck, and the widening of the nipple, and also they have the like horseshoe kidney. Yes, this is associated with the Turner syndrome. टर्नर लाइक फॉर एवर क्वेश्चन, ठीक है, फॉर एवर क्वेश्चन है. टर्नर सिंड्रोम के बारे में एवरीथिंग यू नीड टू रिमेंबर, लाइक हॉर्सू किडनी है ना, हॉर्सू किडनी. एक और हार्ट डिफेक्ट कौन सा होता है टर्नर में? दिस इज नो बार बॉडीज, नो बार बॉडीज 45 एक्सो. एक और बताओ. Cardiac defects, another one, cardiac defects, which is the associated with the Turner syndrome. Turner syndrome is a very very important one, and this is forever. And यहाँ पर main चीज याद रखनी है, यहाँ पर IQ is the normal, completely normal. You can see that is one of the neurologists which is working in the AIMS Delhi, and she has the Turner syndrome, है ना. IQ is the normal, but in the Noonan, which is the present in the male, where is the IQ is the like the decrease. Yes, this is the bicuspid aortic wall defect, ठीक है. तो bicuspid aortic wall defect, so that one we need to remember about this one. Okay, there is inferior rib notchings, and the figure of that is figure of E sign or the 3 sign, that is a cortisone of aorta. So that one we need to remember. Now question number 3, that is a 45 hypertensive man with the sudden severe tearing chest pain, that is tearing chest pain, and which is radiating to the backside, which is the what? It is a like the having the pressure which is the different in the both arms. Okay, the pressure which is the different, and this is the tearing chest pains. What is the most likely diagnosis will be there in these conditions? The question number 3, what is the diagnosis will be there in this condition? Tearing chest pains, and here you can see that is something appearance which is the tennis ball appearance. Okay, tennis ball appearance, yes, it's a aortic dissection, tennis, that is a aortic dissection, yes, tennis ball. Tennis ball science. And another one, tennis ball, we need to remember about the tennis ball racket, tennis racket appearance कहाँ था? Tennis racket appearance, where is the S100 is the positive, है ना? S100 is the positive. And in the brain you will see the something that geographical skulls. That is a that is a L that is a LCH. So that one we need to remember. Langerhans cell histiocytosis. Yeah, that one we need to remember. Now there is a classification which is the one is the DBK and another one is Stanford. So for that one, our exam related, we Stanford is the which one we need to remember. Okay, the Stanford which is the A and the Stanford B. The Stanford A and Stanford B. If this is involving the ascending aorta, if this is involving the ascending aorta, A आ रहा है ना, A ascending A and A वाला खतरनाक होता है, जो पहले आता है वो ही मारा जाता है, तो से so stent type A and that all dissection which is the involving the that ascending aorta which is the A1, and here we need the definitive treatment, which we need the definitive treatment, and here we need the what, surgical or medical, here the surgery we need. For the type B, this is they are not involving that ascending aorta, they are not involving ascending aorta, that's why it's a type B. And type B, they can be the like the, if they are not complicated, then we can manage it medically, like the we can like manage the like blood pressures, labetalol, beta blockers, and then medically management. Okay, medically. So that one we need to remember. How hours that how many hours session will be there? It's like 2 hours. Five, okay, 2 hours. Just you need to like the make it more meaningful, interact with and just reply whatever comes in your mind, just reply it. No one is watching you, no one like no one care about you, this one, these things. Okay, you just whatever coming in your brain, just reply it here. Like if you know about that, like Langerhans histiocytes, anything you can like write in the chat, that one will be the more things. Okay, so how we will approach for this one, the patient present with the chest pain. So first we will do the like the biological, that is the blood markers, the blood biomarkers, and then we will do the ECG. From the ECG we will rule out like if there is any kind of the ST elevation, if there is any kind of the like MI case, that will pain will be the radiating to the back, radiating to what, left arm, है ना? And that one biomarkers we will like the we can rule out the angina or the myocardial or the any kind of the abdominal MI or the inferior wall MI. Inferior wall MI already asked like 2-3 AVF, ST elevation. This is a inferior wall MI. Then we will do the urgent CT scans. We will do the CT scans, and if there is any kind of the pulmonary embolism, we will check that one. And also pulmonary embolism, it will is in the ECG S1 Q3 T3 will be there, so we can have the finding of that one. Now urgent CT में we will do the aortic dissection. If Stanford A, then urgent we will do the open surgery. It is after the initial assessment like the airway, breathing, circulation, ये सब कर लिया है ना? Yes, it's 5.5 more than we will do the surgical management, है ना? If less than 5.5, Dr. Made yes Sarma, that is if there is less than 5.5, then we will medically management, and if there is a more than 5.5, then we will do the surgically management. Stanford B, this is uncomplicated, means we will do the medically treatment. If there is a something that is a complicated, then we will do the endovascular treatment. So that one we need to remember all these things. Next, question number 4, that is a young female present with photosensitivity, oral ulcer, joint pain, and the malar race, and which is sparing the nasolabial fold. What will be the here? That is a butterfly, है ना? Butterfly races, that is a butterfly races. And this is diagnosis, which is the that this is the something diagnosis which is the showing the hypersensitivity 3 type 3 hypersensitivity, and where is the so many that antibodies are the positive, where is the like the most common will be the positive ENA will be the most common positive, most specific will be the anti DS DNA, and this is the SLE, and this is the forever questions, that is a SLE. That is a SLE, that is a forever question. So that one we need to remember over this one. Can you tell me butterfly vertebra कहाँ पर पढ़ा था? Where we studied the butterfly vertebra? Butterfly vertebra, which is a syndrome which is name start with the A. Guess करो. The butterfly vertebra कहाँ पढ़ा था? Butterfly vertebra. बटरफ्लाई वर्टिब्रा कहाँ पढ़ा था? वेयर वी स्टडीड दैट वन, दैट इज ए एले गिले सिंड्रोम, दैट इज ए बटरफ्लाई वर्टिब्रा. ओके, एले गिले सिंड्रोम है ना, एले गिले सिंड्रोम दैट बटरफ्लाई. कैन यू टेल मी बटरफ्लाई ट्यूमर कहाँ पढ़ा था? वेयर वी स्टडीड? इट्स समथिंग दैट इज malignant high grade tumors. That butterfly tumor in the brain, butterfly tumor. Can you tell me this one, butterfly tumors, where we studied the butterfly tumors? No, ankylosing spondylitis nahi. Ankylosing spondylitis, there you will see the like bamboo spine, that is a like the dagger spine, bamboo spine है ना. Yes, glioma is the high grade, that is a high grade of astrocytoma, high grade of the astrocytoma, that is a glioma that is है ना. glioma glioblastoma की बात है ना, glioblastoma glioma, that one we need to remember. Now coming back to the SLE, that SLE, that is a mean, that is a bodies, the mean that is a antibodies, which is ANA is the most common, but it's not a most specific. Which one is the most specific? That most specific is anti-DS DNA, which is the most specific one. If anti-DS-DNA is not given in the option, then we will mark the anti-SM, that is anti-Smith antigen, that is a also present in the SLE. Now there is a drug induced SLE. There is a drug which is the mnemonic is the SIP. There is a drug which is the mnemonic is the SIP, which is the drug induced SLE. What will be that one? Yes, that is the most common. Yes, Dr. Daj. Most, yes, most sensitive ANA, but ANA present in so many conditions. Now SIP, SIP, that is a drug induced SLE. In the drug induced SLE, what kind of the antibodies will be present? The drug induced SLE, that one will be the anti-histone antibodies. So that one we need to remember. This is the most chances of these questions. ठीक है, S से sulfonamide, ठीक है, S से sulfonamide, okay, sulfur drugs, any kind of. S से hydralazine, I से isoniazide, okay, and P से what? Procanamide. So that one we need to remember. The drug induced SLE, but is anti-histone antibody is the positive, and this is the what? Hydralazine. So that one we need to remember. Next one, that is a rheumatoid arthritis. There is a morning stiffness, patient present with the morning stiffness, and something there is a hand key deformities. That can be the any kind of the like the swan neck deformities. है ना. There is a CCP will be the positive. Drug induced, we already discussed, that is anti-histone one. And the Sjogren's syndrome is a dry Zika syndrome. There is Zika syndrome, the dry eye, dry mouth, है ना. There is a anti-RO, anti-LA, that is anti-RO, anti-LA will be the positive. ठीक है. And another one, that is a anti-phospholipid, where is that they will give you the something history. Anti-phospholipid syndrome, they will give you the history of the what? They will give you the history of the abortion history. Okay, recurrent abortion, anti-phospholipids. Okay, anti-phospholipid, yes, swan neck and botanier, है ना. Yes, correct guys, great. Like the आप जितना यहाँ पर इन्वॉल्व हो गए इन सब चीज़ों में, that one will help you in your exam, है ना. And these are important one. Next one, there is a limited scleroderma. There will anti-centromere will be the positive. Anti-centromere, which is the previously it was known as a Crash syndrome. Nowadays this is the like the there is a scleroderma two type, like limited and diffuse one. In the diffuse one, it will be the like the scleroderma 70, that is anti-isotopomerase 1, that one will be the positive. Now AMA is the very positive. That AMA is the very important one. That is a positive in what? That is a PBC. ठीक है, तो अम्मा का लड़का कैसा है? BC, है ना. अम्मा का बेटा कैसा है? PBC. So these kind of the questions, this is already asked. So that one we need to remember. The primary biliary cirrhosis. तो अम्मा का पहला बेटा कैसा है? C, है ना. इसे याद रख लेना. C मतलब चार्मिंग, है ना. Now next one, PBC. Next one, this is the important one. अम्मा याद रखना, ठीक है ना. अम्मा PBC, है ना. अम्मा का प्राइमरी पहला बेटा कैसा है? चार्मिंग, है ना. So that one we need to remember. Next one, Hashimoto-thyroiditis, Hashimoto-hypothyroidism, Hashimoto-Hurtl cell. In the Hurtl cell, there is an anti-thyroid peroxidase. That is a neat PG question. So that one we need to remember. Anti-thyroglobulin, that one will be the positive. Now, dermatomyositis or polymyositis, there is a like the muscles are that like patient pura paralysis हो जाता है. In that one, that is anti-Jo1 positive. Anti-Jo1 positive. That is a PYQ. Now, anti-basement is already asked. Anti-basement membrane, that is good posture syndrome. That is good posture syndrome. Good posture syndrome we will discuss in the like detailed manners. There is the like the what kind of the hypersensitivity, and this is the associated with the collagen type 4 defect. Anti-basement जितने basement membrane defect है all will be the type 4 collagen defect. Type 4 collagen like Alport हो गया, like good postures हो गया है ना, और इनके क्या complications रहेंगे we will discuss about this one है ना. नेक्स्ट वन सीलिक स्पोरो, दैट इज लाइक द अगर जीआईटी में से कोई पैथो से और मेडिसिन से रिलेटेड कोई क्वेश्चन पूछा गया, सबसे ज्यादा पूछा गया सीलियक डिजीज. द सीलियक डिजीज दैट इज एंटी ग्लैडियंस, दैट इज आईजीए, एंटी माइसियल, दैट इज आईजीए, एंड एंटी transglutinase, that is IgA positive. Now celiac disease, can you tell me there is a celiac disease, what is a drug of choice for the celiac disease? Drug of choice of the celiac disease. And celiac disease, there is like the there is allergy to the bro, that the barley, राई, ओट, व्हीट से इनके एलर्जी रहती है, ठीक है. एंड इन दैट वन दैट इज लाइक द विलस एट्रोफी विल बी देयर. अगर विलस एट्रोफी हो जाएगी, सो विलस इज हेल्पफुल फॉर दे इंक्रीज द सरफेस एरिया, दे इंक्रीज द व्हाट एब्जॉर्प्शन ऑफ द फूड, दैट लाइक दे इंक्रीज लाइक द डाइजेशन, they increase the digestion. If there will be villus atrophy will be there, then it will be like patient will present with the diarrhea. Patient will be the present with the diarrhea, metabolic acidosis, and they will be having the like the steatorias will be there. If steatorias is there, then it is like this something fat soluble vitamins are the goes, and they will cause the deficiency of that one. Celiac sporo, there will less atrophy, and that is cause what? That is cause the protein losing enteropathies. That is a protein losing enteropathies. So that one we need to remember. And here is a drug of choice, which is in the dapsone, which is dapsone. Now in the 5 to 10 cases, this is the ionized set questions. Then 5 to 10 cases, there is a something which is associated with something lymphoma. A T cell lymphoma or B cell lymphoma? Can you guess? It's a yes. Bro is avoided. Yes. What is a? It's in the that one. There is a T cell. It is a T cell lymphoma associated. Okay, so it's remember, and it's associated with the herpetiform dermatitis. Yes, great. Bye. Okay, Artha, it's good. And celiac sporo, that one we need to remember. There's a higher chance that they will ask you. Okay, protein losing enteropathies, celiac disease, है ना? The 3 cell. Now PNK, that is a myeloperoxisite, that is a microscopic polyangiitis, that just disease, ठीक है. So that one we need to remember. Now Wegener's glomerulomatous, that is a CNK, that is even that is a Wegener's glomerulomatosis, ठीक है. Wegener's glomerulomatous, where is the present, is the patient will present, can be the present with the saddle nose, ठीक है. Saddle nose ENT के कहाँ याद रखने आपको? The TB, leprosy, and the syphilis. Which वाला? Congenital syphilis, and this one Wegener's glomerulomatous, where you will see that सैडल नोज. सो सैडल नोज कहाँ पर है, एक बार बता दो. दैट इज अ सिफिलिस, ठीक है, कंजेनाइटल सिफिलिस, टीबी, लेप्रोसी and the Wegener's granulomatous, where you will present, the patient will present with the saddle nose, ठीक है. सैडल नोज, so that one we need to remember, ठीक है. अब सैडल से याद है, सैडल एक सैडल जॉइंट होता है ना, सैडल जॉइंट, दैट इज प्रेजेंट इन हियर, सल्लू वाला है ना, MI said, that is in the ear, ossicles, there is ossicles is there, MI said, ठीक है. MI said what? मेलियस इनकस के बीच में जो जॉइंट है, दैट इज अ सैडल जॉइंट्स, एंड द इनकस स्टेपिस के बीच में, दैट इज अ बॉल एंड सॉकेट, दैट इज अ बॉल एंड सॉकेट. सो दैट वन वी नीड टू, दिस इज आइनेसेट क्वेश्चन भाई, इतना इजी क्वेश्चन पूछा गया था. दैट इज इनकस स्टेपिस, दैट इज अ बॉल एंड सॉकेट वन, दैट ठीक है, बॉल एंड सॉकेट, मेलियस इनकस ये वाला है ना. नाउ इफ यू आर लाइक द सर्चिंग कि भाई मैं सिर्फ एक ही टॉपिक पर रहूंगा, एक ही टॉपिक को ऐसे ऐसे बढ़ाते रहेंगे, तो दैट वन नॉट इंटीग्रेट, एंड दैट वन नॉट रिकॉल योर मेमोरीज. आई एम नॉट हियर टू फिनिश योर सिलेबस, ठीक है. इधर ये है कि अपन सारा का सारा जो भी एग्जाम, जो भी दिमाग में आ रहा है वो कर सकते हैं, ठीक है. यस, दैट इज अ वेगनस ग्लोमेरुलर, दैट इज स्मॉल सेल वेस्कुलाइटिस, है ना. नेक्स्ट वन, parietal, these are though not that much important. Now alcoholic patients, always remember alcoholic patients और the pneumonia की बात की है, alcoholic patients plus pneumonia, you will think about what? You will think about the only one disorders. You will think about only one disorders. Can you tell me which one? That is a something कैसे स्टार्ट होता है, बताओ ना कहाँ आगे. यस, अच्छा, क्लेप्सिला निमोनी, क्लेप्सिला pneumonia. Okay, so that one we need to remember. Klebsiella pneumoniae, that is a red currant jelly sputum, red currant jelly sputum, and this is the main hint. And there is a alcoholic male patient present with the pneumonia के साथ में, that is a red currant jelly sputum, that is a Klebsiella pneumoniae. So that one we need to remember. Now sputum से बहुत सारे क्वेश्चन सॉल्व हो जाएंगे. तो sputum कैसे, rusty sputum in the streptococcus pneumoniae which cause the lobar pneumonia, and also streptococcus which is the source the Drotman colonies and the Kermcoin colonies which is having lancet shape, and it's alpha, that is alpha beta, alpha hemolysis, beta hemolysis is pyogens. ठीक है, ये alpha hemolysis, and that red currant jelly sputum, that is a this one Klebsiella pneumoniae. Yellow sputum, that is something that is infection which is like the bronchiectasis, yellow sputum with the tram track appearance, and the patient will be having the clubbing, that is a bronchiectasis, which is like obstructed lung disease, है ना. So that one we need to remember. Red currant jelly stool, that is intussusception substance, that red currant jelly stool, that is intussusception substance. So that one we need to remember. Intussusception, there is a like the donuts, that is a donut signs, the target sign on the ultrasound, that one will be the positive. Okay, and एक और sign बच गया, कौन सा वाला? intussusception है, the donut sign हो गया, target sign हो गया, एक ये वाला कौन सा वाला? claw hand, that is a claw वाला, claw sign है ना, claw sign, that is also will be present in the intussusception. That one we need to remember. Now sputum की बात करें, rusty sputum in the streptococcus pneumoniae where it cause the lobar pneumonias. ठीक है, most likely it will be implemented in the like the those are having the like immunocompromised HIV के patients जिनकी CD count like the less than 100 है. ठीक है, उनके अंदर they will give you the history, so don't confuse and don't mark the blindly like कि अगर CD count ऐसा कुछ पूछा तो 0 वैसे ही लगाऊंगा. ठीक है, so that one claw sign in the intussusception, the rusty sputum, the streptococcus pneumoniae. Now there is a yellow sputum, there is a yellow thick sputum, ठीक है, yellow thick sputum, that is bronchiectasis. ठीक है, so that one we need to remember about this sputum. Now ये सबका फेवरेट. ठीक है, nowadays they change this name. ठीक है, ये इसका नेम चेंज कर दिया. That is what is the diagnosis of this one? Question number 6. The question number 6, the infant present with the projectile non-bilious vomiting. First hint यहीं पे मिल गया, non-bilious vomiting, that is like the duodenal atresia. They will give, if they will give history that any kind of the vomiting, but they will give the bilious vomiting, that will be the bilious vomiting. But here in the IHPS pulmonary stenosis where you will see the non-bilious vomiting, है ना, non-bilious vomiting. और यहाँ पर देखो एक कुछ मास है, ऐसा कुछ है ना, there is something mass. What is the name of that mass? The olive shape mass, that is olive shape mass. Can you tell me what kind of the metabolic abnormalities here you will see? The projectile vomiting, hypochloremia, and these kind of the symptoms. So the patient will be having the what? The metabolic alkalosis. Yes, great. Yes, yes, that is hypochloremia, hypokalemia, metabolic alkalosis, paradoxal aciduria, olive shape mass. ठीक है, olive shape mass, that is a abdominal mass, है ना, ISPS. Can you tell me what kind of the surgery we do for this one? The treatment क्योंकि इसके अंदर क्या होता है, ये this is the stomach and this is the something esophagus, और ये esophagus, ये stomach, और this is the pyloric stenosis, और यहाँ पर आ गया तो what kind of the sign you will see? What kind of sign you will see? The single bubble sign. यहाँ पर when we will do, that is a single bubble sign. ठीक है, single bubble sign. Yes, what is the name of that surgery? Yes, it's a Ramstead. That is a रामस्टेड सर्जरी. ठीक है, ओलिव शेप मास्क से पाइलोरिक स्टेनोसिस से राम जी बचाए. ठीक है, रामस्टेड. ठीक है, रामस्टेड सर्जरी. सो दैट वन वी नीड टू रिमेंबर अबाउट दिस वन. This is the very important one. This is already asked. Now there is a bubble sign. This is the old PYQs, मतलब ट्रेडिशनल बन गया कि मतलब कि एक एक्सरे देना है जिसके अंदर अगर बच्चों को कुछ इजी क्वेश्चन पूछना है तो उसमें से ये पूछेंगे कि विच वन इज द ट्रिपल बबल साइन, विच वन है डबल बबल साइन, विच वन है मल्टीपल बबल साइन. सिंगल बबल साइन वी डिस्कस, दैट इज पाइलोरिक स्टेनोसिस, दैट इज a pyloric stenosis, and the second that double bubble sign, this is the duodenal atresia, which is associated with one syndrome, which is what kind of association with the like duodenal atresia. कैसा एसोसिएशन मिलेगा? it association with the one syndrome which is having like loss of apical folds, and there's something where is the simian crease is the lost, and IQ is the like the decreased, है ना. Intellectual disabilities will be there. This is associated with the Down syndrome, है ना, Down syndrome. So that one we need to remember. डाउन सिंड्रोम के साथ कौन सा लुकीमिया एसोसिएशन होता है? विच लुकीमिया इज एसोसिएशन पैथोलॉजिकल क्वेश्चंस. विच लुकीमिया, एएलएल और ईएमएल. ये बताओ कि चिल्ड्रन में होता है एएलएल, बट ईएमएल इन द adult is, and the rest all like the based on the like the what kind of the history and what kind of the myeloblast is there. So Down syndrome which is associated with the what kind of the leukemia? There is EML, not ALL, है ना, EML M7, EML M7. So that one we need to remember. EML की क्या history they will give you the something history of the like that. DIC will be the most common presentation. Blindness can be the present, ठीक है, blindness can be the present, and they will have the oil rods or something. Faggot cells will be there. Oil rods most likely will be in the M3, and the translocation will be 15 17 will be there. And the AML, what kind of treatment we will do? We will do the atra and arsenic. One metal we use for that leukemia treatment, that is arsenic, and this is used in AML. But ELL, which is the most common present in the children, that is children, बच्चों में, ठीक है, children, and where that one will be present with the what external tenderness, what it will be present with external tenderness. So that one we need to remember, है ना. Now there is a third one. There is a jejunal atresia, which is the shows what triple bubble sign. There is a triple bubble sign. The triple bubble sign, that is jejunal atresia. Multiple bubble sign, that is ileal atresia. That is a ileal atresia. So that one we need to remember. That one we need to remember, है ना. Now coming to the question number 7, which is the like the severe epigastric pain which is radiating to the back, which is, and it's improve while the leaning forward, and here is the something, there is a 2 which is the affect, there is a yes, this is the 2 which is the that is 2 test is positive, like serum amylase and the serum lipase is the positive, but most specific is the serum lipase which is elevated. This is the most specific one. This is the already asked, है ना, most specific. This is the UPSC CMS 2025 questions. There is a which of following is the most specific. वो line दे दी थी सारी, and they ask like the serum lipase most specific, most common, it's a serum amylase, है ना. And this is what acute or chronic pancreatitis. This is the there is a acute pancreatitis. What is the most common cause for the acute pancreatitis? Most common cause is acute pancreatitis, that is a gallstone. So that one we need to remember, gallstone. People used to make the mistakes like in the chronic or इसमें सब में alcohol सोच लेते हैं. Alcohol is the most common in the chronic pancreatitis. Can you tell me what kind of the necrosis you will see in the pancreatitis? What kind of necrosis, like the liquefactive coagulative fat necrosis, like the gangrenes, और किस तरीके का होगा? What kind of this one will be there in the pancreatitis? What kind of necrosis you will see? You will see the what? Fat necrosis. You will see the fat necrosis. जब भी fat necrosis की बात आए, you will think about the one of the breast, and another one is pancreatitis. The breast, you will see the like traumatic breast. There is the like the traumatic breast, and another one that is fat necrosis, that is pancreatitis, that is fat necrosis. Yes, and the acute pancreatitis, most common cause is gallstone. The chronic pancreatitis, where is the most common cause is the chronic pancreatitis. Where is the most common cause is the alcohol. Most common cause is alcohol. And about this pancreatitis, what will be the complications? The complications will be the like the I saw that real cases like the 10 days ago, that was the pseudocyst. That is a pseudocyst, है ना, pseudocyst. And if there is a pseudocyst which is having the necrotic more than 30%, that this is called what? Poor prognosis. More than 30% necrosis, that is called what? The poor prognosis. Okay, so that one we need to remember about the pancreatitis. And in pancreatitis, there you will see the 2 signs, which is the Cullen signs and the great Turner sign. Cullen sign, that is a Cullen sign which is the like the that near to the umbilicals, that is Cullen signs, and the great Turner sign, that is in will be the great Turner signs. Okay, the great Turner sign, it will be in the like that sides, okay, lateral sides. And another one, Fox sign, you also will see in the pancreatitis. So that one we need to remember, that Fox sign. If we left untreated until that, it can cause the carcinoma of the pancreas. Most likely it will affect the head of the pancreas, that carcinoma of the head of the pancreas, and where we will do the विपल सर्जरी. ठीक है, ये आपको ध्यान रखना है. So that one we need to remember. That question is the yes, by that question is the different one, है ना. Yes, the pancreatitis generally अगर पूछा है, fate suppon the supposition is the written there, then it's a the fate necrosis, है ना. If they are asking specifically, if they are asking like peripancreatitis or the like the inside wala, intra wala, then intra wala inside, that is a liquefactive, and the peri one, it's a necrosis, and necrosis start from the outside. Now next one is very very important one, question number 8, where is the recurrent fractures, hearing loss, and the bluish discoloration. There is a bluish discoloration you can see, and it's a what? It's a collagen defect of the type 1 collagen defect. Type 1 collagen defect. Type 1 collagen defects, है ना. Type 1 collagen defect, that is a what is the diagnosis? This is the osteogenesis imperfecta, and this is the blue sclerosis or type 1 collagen defect. So ये ध्यान रखने, सारे collagen defect आपको पता रखने. Type 1 collagen defect, osteogenesis imperfecta. Type 2, it's a achondroplasia, where you will see the short stretchers, tri-hand order, starfish hand, and the champagne glass appearance, and autosomal dominant, that is a achondroplasia. And the type 3, okay, type 3, yes, there is a type 3. This is the reticulin fiber, it's affecting the reticulin fibers, so it will be the like Ehlers-Danlos syndrome. कौन सा वाला टाइप? If rare type है then type 2, तो उसमें कोई दिक्कत नहीं है. If there is a vascular reticulin which is like the which is involving the blood vessel, so it will be the vascular type, so ये आपको ध्यान रखना है ना. Next one, the type 4, this is the involving the basement membrane, floor of the basement membrane. ठीक है, the basement membrane, if they are involving, then it will be the two examples, which is the two prominent example, which is the what, which is the Alport syndrome, that is Alport syndrome, and another one, it's a good pasture, syndrome. So that one we need to remember. And type 5 is, it's a for the like the regulating of the type 4, which is the basement membrane wala. So that one we need to remember. So collagen type defect, we saw that one. This is a very very important one. Where is the which of the following vitamin is helpful for the development of the collagens, for the good collagens, and for the like the ठीक है ना. Which vitamin? That vitamin C, which is the helpful for the what? Collagen synthesis, है ना. Hydroxylation of the proline and lysine. Where the vitamin ascorbic acid. That one we need. Osteogenesis imperfecta, there is hearing loss and the bluish discolorations, and this is due to the type 1 से related. 1 किसका है? तो 1 से याद रखना, 1 for the bone, है ना. This is also FMG PYQ. The 1 for the bone, 2 it's a cartilage. So it's a 2. So 2 cartilage, that is 2 cartilage, है ना. Cartilage. Yes, correct. Next one, this is a very very important one. The teenage boys with a recurrent epistaxis, nasal obstruction, and image revealing that is high vascular mass of the nasopharynx. What will be the diagnosis? The question number 9. What will be the diagnosis? Doksa batao. What will be the diagnosis of these conditions? And it is like highly vascular. So what? That is a contraindicated will be the what? It contraindicated. It's a biopsy. Biopsy is the contraindicated, है ना, in these conditions. And there is a face which is the present. It's like the something appearance like the what? It's a frog face. ठीक है, frog face. That is a frog face, like this one. The frog face. And the what kind of the two sign you will see? This is the forever questions, that one we need to remember. That is a antral sign. That is a antral sign or the Holmal-Miller sign. Antral sign. That is seen in GNA. The frog face, है ना. Can you tell me frog से related सारे questions? The frog face. This is the GNA. The frog position कहाँ पड़ा था? Frog position or the tripod position, है ना. tripod position, where is the having the patient having the difficulty. So frog position में the frog position, the frog sign and ultrasound, that is a frog sign, that is a frog sign on the USG. That is a frog position, that frog position which is the what, epiglottitis. ये ध्यान रखना. फ्रॉग साइन अल्ट्रासाउंड, दैट इज अ एनेनकेफेली. ये ध्यान रखना आपको, ठीक है. That one we need to remember. The frog sign on ultrasound, that is anencephaly. There is a frog position which is epiglottitis, acute epiglottitis, है ना. And the frog sign on ultrasound, that is anencephaly. So that one we need to remember. Next, coming to the next question, which is the middle age. There is itching after taking the hot bath. That is a main buzzword, main hint for this questions. After the taking bath, and the CBC shows the rise the what, hemoglobin, that increase the hemoglobin. If there is a woman, then it will be that what is in the major criteria. If there is a woman, then it will be the like. If there is a male, the major criteria or minor criteria matter, it's in the major criteria. It will be the more. If there is a male, then it will be the more than 16.5, and it's a female. It's female, then it's more than 16. The hemoglobin is so much high, and the hematocrit is also high, and there is a what, mutation कैसा है, JAK2 mutation. Yes guys, yes, great, that is a polycythemia vera. Vera. So that one we need to remember, that is JAK2 mutation. In the major criteria, there is a mean which is the 16.5, it's a female, then it's a 16, more than 16. And if there is a, we do the here the serum erythropoietin level, which is the below the reference level, which is range for the normal, है ना. JAK2 याद रखना है ना, polycythemia. And what kind of, they will give you the main buzzword, that is aquagenic pruritus, and they will give you the hot water, है ना, hot water, not a cold water. ध्यान रखना, cold water का different question से आगे आएगा, but this is the hot water. That cold water का essential thrombocythemia, there is platelet is so much high. Here is the, that RBC is so high, that is aquagenic pruritus, है ना, pruritic following the warm bath. That one we need to remember. The EPO will be the normal. The patient can be the present with the fatigueness, pruritus, and facial plethora, है ना, facial plethora, and the burning pain on the erythemas, pallors, and the cyanosis will be there, and the thrombosis and gouty arthritis can be the then can be the having the that can be have the symptoms. So what kind of treatment we will do? The hydroxyurea and phlebotomy. Okay, phlebotomy once a time they ask, and the aspirin we will start. Okay, so that one we need to remember. Next, question number 11, that is a young sexually active male painless genital ulcer followed by the what, generalized rash involving the palm and sole. What will be the diagnosis in these conditions? The question number 11, what kind of the diagnosis will be there in that conditions? The question number 11, there is a what? This one will be the secondary syphilis. That one will be the secondary syphilis. Now this is the very important, and 100% मैं लिख के देता हूँ ये पेज नंबर. Which one is the page number? The page number is the 9. पेज नंबर 9 से एक क्वेश्चन पक्का in your exam, ठीक है. So that one we need to remember about this one. And first तो पूछेंगे कि what is this one is the caused by the Treponema pallidum, which is the spirochete, and what kind of the motility it will show? The corkscrew motility है ना, spirochete, corkscrew motility. This one, corkscrew spirochetes. कॉक्सक्रू. तो कॉक्सक्रू से बात आई, कॉक्सक्रू से तीन चीज आपको ध्यान रखना. एक तो स्पायरोकेट विच इज द कॉक्सक्रू मोटिलिटीज, है ना, कॉक्सक्रू मोटिलिटीज इज देयर, ये आपको ध्यान रखना है. दूसरा वाला कॉक्सक्रू इसोफेगस, दैट इज डिफ्यूज इसोफेजियल स्पाज्म, दैट कॉक्सक्रू इसोफेगस, दैट इज डिफ्यूज इसोफेजियल स्पाज्म. अनदर वन कॉक्सक्रू हेयर्स, दैट इज अ पेरीफोलिकुलर हेमरेज, दिस इज ड्यू टू द विटामिन डेफिशिएंसी. व्हाट काइंड ऑफ विटामिन डेफिशिएंसी? दिस इज विटामिन सी डेफिशिएंसी, एस्कॉर्बिक एसिड डेफिशिएंसी. दैट इज अ कॉक्सक्रू हेयर, दैट इज कॉक्सक्रू हेयर. सो दैट वन वी नीड टू रिमेंबर, है ना. नाउ पेनलेस और पेनफुल के आधार पे आपको आंसर नहीं करने, क्योंकि मैंने एक रिसेंट जीटी इन द नेशनल जीटी टेस्ट ऑफ द एनएलसी आई गेव दैट क्वेश्चंस एंड एवरीवन मार्क दैट वन पेनलेस और पेनफुल के बेस्ड पे. नाउ देयर इज अ रिटन दैट डार्क फील्ड माइक्रोस्कोप में यू विल सी द समथिंग अपीयरेंस which is the showing like Treponema pallidum which cause the syphilis. तो वहाँ पर डुकरेई और the syphilis नहीं है. Generally syphilis will be the painless. डुकरेई the sanchroid will be the like which is caused by the Haemophilus ducreyi, which is the painful, but then sancre which is the like pain which is the painless. तो ये तो आपको ध्यान रखना ही है, but this is the typical one, but here we need to see. Now synchroid, croid, oid, cry, do cry, it's a painful soft purulent, it's painful है ना. And what in the gym science, what kind of appearance it will be show? It will show the school of the fish appearance. So that one we need to remember. This is a 100% exam question, then already asked previously. Now in the syphilis, there is syphilis troponema pallidums, and it's about the primary, secondary, and it depends on the what incubation periods. If there is a history of the 3 week, then it's a primary. It's a more than 3 week, more than 3 to 10, it's a primary, secondary. And there is the something which is the condyla lata and acuminata. Lata will be the flat, it's a flat lesions. लाटा will be the flat lesions, and acuminata गोभी के जैसा है ना, cauliflower, that cauliflower it will be the not a flat है ना, ये ध्यान रखना आपको. And in the tertiary you will there will be the mac what gummas बन जाएंगे है ना. And in neurosyphilis you need to remember this is the like the organ pupils and all. So that one we need to remember. Next one is the like the LGV. There is a generally it's caused by the chlamydia trachomatis. That is a L2, L1, L2 and L3. There is LGV. ठीक है. LGV खास क्या बात है? Ulcer is not painful, but that is inguinal killer है ना. Inguinal killer that is painful because of there is a lymph node enlargement is there. So groove sign. What kind of sign you will see? That is a bubo, which is the enlarging and the painful, that the unilateral lymph node, that is a groove sign is positive. So that one we need to remember है ना. Latte LGV ये ध्यान रखना आपको ना. Donomanosis, which is the Klebsiella granulomatis, ठीक है. Donomanosis, which is the like the pseudobubo है ना, pseudobubos, that is donomanosis. And another one genital herpes ये ध्यान रखना आपको. There is a SCV. There is a two type of SCV1 and the SCV2. SCV1 and SCV2. Now आपके FMG में क्या आया था? FMG Gen 2026. What question was asked about genital herpes, or the SCV1 था, SCV2 था? That was SCV1. SCV1 which is the like exposure to the cold exposure से है ना, cold environment, exposure to the cold environment, that is SCV1, which is the like the herpes labialis. If left untreated और कहीं पर भी इस यहाँ पे हार्ट टेस्ट किया फिर आईज में चला गया, that cause the what viral keratitis, herpes dendritic ulcer है ना, viral keratitis. So it has SCV1 which is the herpes labialis वाला, and there is a dendritic ulcers or the viral keratitis, which is the drug of choice. Where is the drug of choice is what? Acyclovir है ना, 800 micrograms. There is a 5 dose for the 14 days. So that was question asked in FMG Gen 2026. That is a which drug we will use for this dendritic ulcer. वो photo दे रखा था dendritic ulcer का. So that one we need to remember about this one. Don't forget, please. SCV1 which is the herpes labialis and the dendritic ulcers or the viral keratitis. SCV2 नीचे वाला, and 1 ऊपर नीचे 2. So that one 2 which is the genital ulcer. So that one we need to remember है ना. This is the very important one. सब सही चल रहा है ना, स्पीड ओके. और नाउ वी नीड टू इंक्रीज दैट वन स्पीड. अगर करेंगे तो 4x में हो जाएगा. नाउ आई एम पुटिंग माई होल एनर्जी हियर टू जस्ट लाइक मेक श्योर कि इसमें से कुछ क्वेश्चन आ जाए. एंड आफ्टर द फिनिशिंग दैट एग्जाम आई विल मीट यू एंड आई विल टेल यू दिस क्वेश्चन एटलीस्ट 25 to 30. Please do believe in this content, because it's my hard work of the like lots of years which I analysis of that one. I worked in the like so many apps, so many like in the PYQ, QBank and all. Then I analysis what is the important one, what is the, they will ask you like ये जो क्वेश्चंस मैंने दिए है ना, तो इनके बगैर मतलब कि पेपर पूरा नहीं हो सकता है ना. So that one we need to remember, and don't leave this PDF एटलीस्ट एक या 2 बार देख लेना, और लास्ट के 10 days में एक बार प्लीज देख लेना. एंड आई विल कम अप विद द लॉट्स ऑफ मोर सेशंस. ओके, नाउ क्वेश्चन नंबर 12. देयर इज अ फीवर कंजक्टिवाइटिस. कितनी एज है? 2 years. एंड द स्ट्रॉबेरी टंग्स, द क्रेकल, देयर इज क्रेकल लिप्स एंड सर्वाइकल lymphadenopathy मोर देन 5 days. व्हाट इज डायग्नोसिस? थैंक यू रोहित भाई. थैंक यू विश फॉर कर्मा. डॉक्टर अभिषेक, आई टोल्ड यू दैट इज इंक्यूबेशन पीरियड्स, द प्राइमरी एंड द सेकेंडरी. मैंने वो इसमें PDF में दे रखा है, आई टेल यू है ना. थैंक यू डॉक्टर अपेक्षा. दैट इज अ कावासाकी और स्कारलेट. इफ दैट इज के पहले आता है, एस पहले आता है, द के पहले आता है ना, तो इट विल बी इन द चिल्ड्रन, इट विल बी इन द चिल्ड्रन, लेस देन एज इज लेस देन 5 ईयर, है ना, लेस देन 5 ईयर, दैट इज अ कावासाकी, दैट इज अ कावासाकी। कावासाकी वो दोनों में ही दिखता है स्ट्रॉबेरी, था ना, दोनों में स्ट्रॉबेरी, बट इट्स कावासाकी, इट्स लेस देन 5 ईयर। इफ देर इज समथिंग एडल्ट की हिस्ट्री दे रखी है, देर इज समथिंग एडल्ट और द मोर देन 5 ईयर, मोर देन 5 ईयर का चाइल्ड है, देन इज स्कारलेट, देन इज स्कारलेट। सो व्हाट they will see, now see the difference. This is not my tables, and that is I like the, this is only for the educational purpose, so don't pay, please put that copyright, ठीक है। this is the, I am giving you the credit to the original content creator who is made this one, है ना, the Scarlett and Kawasaki. If there is a age which is the less than 5 year, then it's a Kawasaki. If it is the 5 to 15 years, then it is a Scarlett, Scarlett adult, तो बड़ा, Scarlett बाद में आता है तो बड़ा, ठीक है, ये ध्यान रखना। नाउ डॉक्टर विकास सी दिस वन, द सैंड पेपर लाइक अपीयरेंस, बोथ दोनों में मिलेगा, ठीक है, दोनों में मिलेगा, स्ट्रॉबेरी टंग्स दोनों में मिलेगी, है ना। द prominent, that is a prominent pharyngitis, that one will be the like the in the that scarlet, so that one we need to remember. And first we will see, when we will, the patient will present, we will check the conjunctivitis is there. If conjunctivitis is there bilateral, then we will diagnose it's Kawasaki. If not, then it will be the, it one will be the what, it one will be the that is a that one is a scarlet. So ये ध्यान रखना आपको। And coronary artery aneurysm if left untreated, and the cardiac involvement is very less in the scarlet, but in the children, in the Kawasaki, this is the one important, है ना, तो ये ध्यान रखना आपको। यस डॉक, यस, थैंक यू डॉक्टर अर्थ। So Kawasaki, Dr. Vikas, did you clear that one with the age of that one? If age is less than 5, the less than 5, children is less than 5, and the fever is more than 5 days, that is Kawasaki. If there is age is more than 5 to 10, 5 to 15 और कुछ भी मानो, that is स्कारलेट। स्कारलेट बड़ों में, एस बाद में आता है, के पहले आता है, तो के छोटों में, एंड स्कारलेट एस बड़ों में, ठीक है, तो ये ध्यान रखना है, ऐसे इस तरीके से याद कर लेना। दैट इज नॉट दैट मच इंपॉर्टेंट, लाइक इसके अलावा और कुछ भी आपको याद नहीं रखना, ठीक है। अरे डॉक्टर तन्मय, पान खाता बच्चा इज डिफरेंट वन, पान खाता बच्चा तो वो है मीडियम वेस्कुलाइटिस, हाँ, कावासाकी, पान, दैट इज पॉलीआर्थराइटिस नोडोसा। कैन यू टेल मी, पॉलीआर्थराइटिस पान खाता बच्चा की बात आ गई तो पान खाता पॉलीआर्थराइटिस नोडोसा, इट इज एसोसिएटेड विद द वन डिसऑर्डर्स, व्हाट इज वन डिसऑर्डर विच एसोसिएशन, पान खाता बच्चा, तो प्रीति मैम का निमोनिक है ना। The cream features, yes, cream features in Kawasaki. That is a hepatitis B के साथ association, that is पान, polyarteritis nodosa, खाता बच्चा, C और B, B है ना, ready, this is the B. Now coming to the question number 13. Question number 13. The painful oral ulcer, flaccid skin blister, and genital rubbing of the skin, that is a peeling off sign, that is a Nikolsky sign. Nikolsky sign is positive, this one. And this is what will be the diagnosis? What will be the diagnosis, Dr. Saab? Batao? What will be the diagnosis in these conditions? That is Nikolsky sign positive, and which will be differentiate between the pemphigus vulgaris and pemphigus vulgaris and bullous pemphigoid. Bullous pemphigoid, where Nikolsky sign will be the absent. It is the Nikolsky sign is positive. It one will be the what? बताओ। Nichols की sign is the positive, that is a pemphigus vulgaris, it's a vulgaris। वल्गेरिस का कोई मतलब नहीं है, वल्गेरिस मतलब मोस्ट कॉमन, वल्गेरिस मीन्स मोस्ट कॉमन, है ना। निकोल्स की साइन, नाउ देयर इज अ बुल्लस पेम्फिकोइड और पेम्फिगस वल्गेरिस, देयर इज अ मेकिंग द डिफरेंस, वेयर इज द निकोल्स की साइन, देयर इज अ निकोल्स की साइन absent in the bullous pemphigoid, so that one we need to remember. And pemphigus vulgaris, you can see this is the Nikolsky sign, it is a positive, it's a positive, है ना। The dermatitis herpetiformis, where is the patient will present with the itching, सब में present होगी, but they will be crusting and the vesicles will be present, and this is the association with the celiac disease, so that one we need to remember, है ना। That one, a linear IgA bullous dermatosis, that is a grouped lesions, that is grouped lesion, and it can be the annular pattern, it can be the linear pattern, है ना। Now question number 14. If we will go the fast, then we will finish it within the 2 to 2.5 hours, and that one will be the more useful, है ना? Now coming the postpartum female present with a severe headache, vomiting, the papillary edemas and the seizures and MR venographies, that is so the feeling defect in the superior sagittal sinus. Postpartum plus neuro symptoms and empty delta sign. Empty delta sign कहाँ पर पढ़ा था? Where we studied the empty delta sign. That empty delta sign. बताओ डॉक्टर साहब. Seizures के साथ present empty delta sign. Yes. It's a cerebral venous sinus thrombosis. Cerebral venous sinus thrombosis. So that one we need to remember. है ना? There is empty delta sign. There is a dural venous sinus thrombosis. There is a of the superior sagittal. है ना? This is already asked. And that yesterday I asked in the our regular batch where I asked the Mount Fuji sign. That is something which is look like something resemble like that one. That Mount Fuji sign. Fuji sign कहाँ पर मिलता है? Mount Fuji signs. That is something tension. I remember Dr. Ritesh gave the first answer of these that questions. Mount Fuji sign. That is tension, pneumothorax, tension what? Tension pneumosyphilis, tension bradycardia. That is a tension pneumosyphilis. This is already asked questions, है ना? ये भी एग्जामिनर के रडार पे चढ़ा हुआ है. माउंट फ्यूजी साइन. That one we need to remember. The tension pneumosyphilis. Yes, Dr. Ritesh. Empty delta sign, that is a dural venous sinus thrombosis. That is a cerebral venous sinus thrombosis. That is a empty delta sign. And the Mount Fuji signs, which is the tension pneumosyphilis. Tension pneumosyphilis. So that one we need to remember. है ना? एक और साइन था, that is I forgot that one. There is a dural tail sign, which is seen in which disease? That name start with the M. Dural tail sign. ये साइन पूछ सकते हैं ना? They can ask. The disease name which is start with the M. Dural tail sign. बताओ. Can you tell me? Yes, doc. Yes. That is Dr. Ritesh. Jenny Taylor's This for Karma. That is Rohit Bhai. Hemant Singh. That is Rimpi. Nishant Royal. Tanmay. Is it? Dural tail sign. Meningioma. है ना? Dural tail sign. ये भी ध्यान रखना लेगा. Remember. Now next one. The question number 15, the child barking cough, inspiratory stridors and the hoarseness, and especially in the night time. The hoarseness in the night time, that is something you can see. That is a steeple sign. That is a group, and which is it is caused by the most common cause by the it's caused by the virus or bacteria. It's a virus, है ना? Para influenza virus. Para influenza virus. The group steeple sign, है ना? Church steeple sign. The group. Great. Para influenza virus. The group. What is another name of the group? That is acute laryngobronchitis. Next one. ये एक थोड़ा एसोसिएशन विद लाइक द टॉक्सिटी ऑफ द विटामिन, समथिंग फेट सोल्युबल विटामिन्स. इसकी हिस्ट्री है दैट हेडेक, ट्रांजिएंट विजुअल ब्लरिंग एंड द पल्सेटाइल टिनिटस एंड फंडस एग्जामिनेशन यू सो द पेपिलरी एडिमा, बट MRI is the normal, but here you can see the something, there is a growth of the tumors. There is something growth of the tumors and patient. Thank you doc, thank you. ऐसे ही तो मजा आता है. अगर मैं प्रोफेशनली पढ़ा हूँ तो फिर कोई मतलब नहीं है ना. That is lots of the apps is there, lots of expertise is there, but what comes in our mind and what we need to remember, that is the main thing, that is a matter. विटामिन की कोई डेफिशिएंसी है, विटामिन डेफिशिएंसी और तो टॉक्सिटी, ये बाइफेजिक स्ट्राइडोर्स हो गया. यस, विटामिन ए टॉक्सिटी, दैट इज अ स्यूडोट्यूमर सेरेब्री. It is a pseudotumor cerebri, and this is due to the what? Vitamin A toxicity. atoxicity. And patient will be they will present with the intracranial, increase the intracranial pressures, and due to this pressure will be increased, then they will have the headache. They will have the headache, so that one we need to remember. So that one we need to remember about this one. Now question number 17. There is a newborn babies with a persistent jaundice, pale stool and the dark urine. That yahi se question khatam ho gaya. And they reveal that the hepatomegaly is there is something that is a most common cause of what kind of the jaundice? Pathological jaundice in the neonates. Pathological jaundice. There is something disorder, that is the name of that biliary atresia. No, not till Dr. Akhil. Don't operate. That class will be there like the 1.5 for 1.5, 1.5 hours more. The biliary atresia, where you will see the what kind of sign. If normal atresia, there is no triangular the code sign. Here you can see the triangular code sign. Triangle code sign. अब ये मैंने क्या बात की? What I discussed right now. There is something biliary atresia. If there is this is the liver, है ना? This is the liver. There is a right hepatic vein, left hepatic veins, and this is the comes in the common hepatic veins. Common hepatic, not the vein, that is duct. Left hepatic ducts, right hepatic ducts, and this is the something, there is a cystic duct which is coming from the gallbladders, gallbladders, and these are this one. If there is any kind of the biliary atresia, there you will see the irregularly something. There is something irregular of that one. They are increasing the pressure of that one, and that can lead to the what? Pathological jaundice, that biliary atresia, biliary atresias. Yes, Dr. Jenny. Next, question number 18. There is middle-aged woman present with fatigueness, pruritus, and xanthosmas, and there is a lab shows with elevated ELP and positive AMA positive. AMA मैंने बताया था ना, EMA. There is I don't know यार about the symptoms कि मेरे को सारे symptoms same जैसे लग रहे हैं, but there is something, there is a buzzword which is the like what, which is the one buzzword that is anti-mitochondrial antibodies, that is AMA positive. और AMA का पहला बेटा कैसा है? प्राइमरी बेटा कैसा है? चार्मिंग. फर्स्ट चिल्ड्रन इज चार्मिंग. So it's involving that hepatic ducts, intra and extra hepatic ducts, and it's having the worst prognosis. And the AMA is the positive, and the patient can be the present with the ascites or any kind of the ascites or splenomegaly or the hepatomegaly. Ascites के साथ में तो we will do the fluid thrill test, है ना? Fluid thrill test करेंगे, fluid निकालेंगे. That is PBC, AMA PBC, है ना? ये ध्यान रखना आपको. Now, patient which is the present with fever, neck rigidities, and aldosterone, that is a aldosterone and fever, rigidity, and headache, which is triad of the what? Meningitis. And CSF analysis we show the lymphocytic predominance and high proteins and low sugar. Low sugar है मतलब something bacteria का involvement हुआ है ना? Bacteria का involvement and high protein and the cranial nerve palsies, that is something which is the like the involving the meninges, and which is the like the having the aldosterone, है ना? Aldosterone. That is a ठीक है. And what kind of appearance you will see? This one. This is a curb web appearance. This is a 2-time FMG questions. So that one we need to remember. And what is the diagnosis here? The TB meningitis. There is a TB meningitis. है ना डॉक्टर? There is TB meningitis. Now how we will differentiate between them? Yes, correct. There is a normal, there in the bacterial meningitis, that appearance will be the turbid, but in the viral meningitis, that one will be the clear, and in the tubercular, that will be the cobweb, and that is a slightly OPQ will be there, है ना? Opacity will be the like degrees, and the fungal meningitis, that one will be the clear, like that one. So in the acute bacterial meningitis, there is a glucose will be the decrease. The glucose will be the decrease and pressure will be the high, but in the viral meningitis, the glucose will be the normal. So that one mean the distinguish factor between the bacterial or the viral. अब tubercular तो mycobacterium tuberculosis है ना, mycobacterium tuberculosis है तो that one will be the decrease, that one glucose will be the decrease, है ना? Glucose will be the decrease and protein will be the like the slightly, it can be the high, In the fungal, it can be the decrease, that glucose, and can be the that will be the same thing which we need to remember. The pressure will be the increase, but in the if spinal is blockage, then tubercular meningitis, that one will be the decrease. So that one we need to remember. Now the TB की बात आ गई तो TB से related. Now TB is caused by the what? It's caused by the Mycobacterium tuberculosis, na? MTB, Mycobacterium tuberculosis. There is the media which is used, what kind of the media we use to grow? That is algae media. In the algae media, there is a something colonies. There is a something colonies, है ना? The colonies. What is name of these colonies? Rough, tough, buff colonies. What kind of colonies? Because this is the high yield questions. Rough, tough, buff colonies, है ना? And in the Jaden stain you can see, and what kind of, how much H2SO4 we use Jaden stain. Somewhere there is 20%, somewhere is the 25%. So 20 to 25% is the CPS transfer for this Mycobacterium tuberculosis, rough, tough, buff colonies, and there is algae media, na? If they will not give you the that name, but by the looking of the photo दिमाग में आना चाहिए, that is algae medias, TB, ध्यान रखना. Now question number 20, there is a present with recurrent episodes of the abdominal pain, psychiatric symptoms, and the something reddish urine on standing, in the woman which is present on the recurrent episodes and abdominal pain. तो यहाँ पर क्या involvement है? Out of also you can see the photosensitivity. So psychiatric symptoms. Thank you डॉक्टर साहब, डॉक्टर आसू. जी सर जी. पहचान लिया. ओके, थैंक यू सो मच, ऑलवेज ग्रेटफुल. ठीक है. दैट इज समथिंग डिसऑर्डर विच इज नेम इज एक्यूट इंटरमिटेंट पोरफायरिया. साइकेट्रिक सिम्टम्स तो समथिंग न्यूरो का इन्वॉल्वमेंट. ठीक है, न्यूरो इन्वॉल्वमेंट प्लस ऑन स्टैंडिंग, दैट इज वेस्कुलर. ठीक है, the neuro plus the neurovascular involvement, that is something one disorders, AIP, है ना, acute intermittent porphyria. Thank you डॉक्टर डेजलिंग, है ना. Thank you. Now there is a enzymes बहुत सारे होते हैं. ठीक है, glycine it will be convert in the end product is the heme, while in that one there is a lots of enzyme is there. Due to the different kind of the enzymes, different disorders will be there. Now we need to remember only two disorders. That is one is the acute intermittent porphyria, and दूसरा आपको याद रखना है पोरफायरिया क्यूटेनियस टार्डा. So that one we need to remember. अब इन दोनों में डिफरेंस क्या, how we will differentiate difference between them? The acute intermittent porphyria, there will be the photosensitivity will be there, can be there, but there will neurovascular neurological symptoms will be there. So in the neurological symptoms will be there, but in the porphyria cutaneous tarda, no neurological symptoms, only photosensitivity or the vascular symptoms you will see. Only vasculars or the like the photosensitivity of the skin related disorders will be there. So एक फोटो दे रखा जिसके अंदर अगर patient will present with the only these kind of the like the vascular symptoms, no neurological symptoms, so that is the porphyria cutaneous tarda, no neurological सिम्टम्स. सो अब इनके एंजाइम्स के बारे में याद रखना है. सो अपन जब पबजी खेलते हैं, when we play the PUBG, while playing the PUBGs, like the what we use our brain, we use कि बंदा कहाँ पे छुपा है ना, and EMW कब चलानी है, कौन सा हेडशॉट लेना है. So that one, how you will remember that PUBG is the deficient in the AIP, and that the PCT there is a urod, that is PCT is the urod. तो how you will remember, यूरिन करने के लिए क्या, PCT DCT loop of Henle, तो PCT there is a urod, so that one we need to remember. That is a higher chances of they will ask you the AIP. अगर AIP that is AIP नहीं पूछा तो PCT they will ask you. They didn't ask that there is a EIP, then they will ask you the PCT. तो EIP में जितने भी symptoms होंगे like the 5P वाला, तो 5P में port wine urine or the like that is a papules or something, the vasculars, and also 5P से neuros, that is a psychiatric symptoms. The patient will be having that like psychiatric symptoms, and abdominal pain, P से port wine urines, psychiatric symptoms, and the pain कैसा, abdominal pain, and the कैसा urine, port wine reddish urine, that is EIP. So most likely chances, और जब brain का use करोगे, when it will be the that involvement of the neurons, then we will use that, and we will learn, and we will play the game PUBG. So PUBG deficient in the AIP. And urine के लिए क्या use होता है? PCT, तो urode. So that one we need to remember. This is a PDF which we need to remember. So first I told you that is a acute intermittent porphyria, there is a euro porphyrinogen 1 synthase, ठीक है, porphyrinogen synthase, ठीक है, and PUBG deficient will be there, and the porphyria cutaneous tarda, there will be urode, ठीक है, abdominal pain, psychiatric symptoms. So that one we need to remember. Only two we need to remember, rest we need to ignore, because brain एक लिमिट के बाद थोड़ी याद कर पाएगा, है ना. Child development, bloody diarrhea, pallors and thrombocytopenia, acute and AKI child, AKI and the bloody diarrhea plus AKI and thrombocytopenia, platelet is down after eating the contaminated food. After eating the contaminated food, what will be there? बताओ डॉक्टर साहब, what will be the what will be the syndrome name? Bloody diarrhea, AKI. That is a, yes, there is a HUS. There is a written here. So what is the triad of the, that is what is triad of that one? The microangiopathic hemolytic anemias. Okay, in the microangiopathic hemolytic anemias, what kind of the cells you will see? Cystocytes. That is a cystocytes. Like if I am talking about the like the iron deficiency anemias, in the iron deficiency anemia, what kind of the cells you will see? Like the यहाँ पर cystocytes है, वैसे वहाँ पर कौन सी मिलेगी? Which is the iron deficiency anemia, which is a microcytic hypochromic anemia there. And यहाँ पर कौन सी सेल मिलेगी? पेंसिल सेल्स, यहाँ पर पेंसिल सेल, और यहाँ पर कौन सी है? सिस्टोसाइट्स. दैट इज सिस्टोसाइट विच इज माइक्रो एंजियोपैथिक. एंड थ्रोम्बोसाइटोपेनियास, प्लेटलेट विल बी डाउन एंड रीनल इनसफिशिएंसी यू विल सी, है ना. एंड दिस इज द कॉज बाय द व्हाट? दैट इज कॉज बाय द ई कोलाई S70157. सो ये भी क्वेश्चन आ रखा है, ई कोलाई S7 एंड O57, ये भी 157, ये भी क्वेश्चन आ रखा है, ठीक है. यस डॉक्टर, यस, करेक्ट, ग्रेट, HUS. So patient present with abdominal pain, bloody diarrheas and the fever, seizures and lethargy, and there is a AKI वाला triad. You will think about the only HUS. now अभी HUS बहुत ट्रेंडिंग में चल रहा है ना, so that one we need to remember. ये वाला तो very important one. 22 questions. There is a Goa mnemonic. In the Goa mnemonic, the alcoholic patients है. Now एक मैं बात बता देता हूँ, जब तक आप ये आंसर दो गोवा वाला. एल्कोहल की कहीं पर बात है, यू विल थिंक अबाउट, अगर एल्कोहल निमोनिया, यू विल थिंक अबाउट द क्लेब्सिला निमोनिया. एल्कोहल और हार्ट से रिलेटेड एट्रियल फिब्रिलेशन, एल्कोहल हार्ट से रिलेटेड एट्रियल फिब्रिलेशन, और एट्रियल फिब्रिलेशन ऑल्सो हाइपरथायरॉइडिज्म के साथ में, ठीक है, हाइपरथायरॉइडिज्म. नाउ एल्कोहल विद द पैंक्रेटाइटिस, क्रॉनिक पैंक्रेटाइटिस, या स्यूडोसिस्ट बोल दो, स्यूडोसिस्ट ऑफ द पैंक्रियाज कार्सिनोमा, वो बोल सकते हो, ठीक है. और एल्कोहल विद द लाइक द इसोफेगस, मेलोरी वीज टीयर्स, ठीक है, मेलोरी वीज टीयर्स, वेयर दे विल गिव यू बजवर्ड दैट इज ए रेचिंग, दे विल गिव यू द बजवर्ड विच इज रेचिंग. और यहाँ पर that alcohol with the what? The delirium tremors, if there is a history of the 48 to 72 hours, है ना, 48 to 72 hours, and there is a, if there is a alcoholic patients and there is Goa mnemonic, alcoholic patients with Goa mnemonic what? Global confusion, ophthalmoplegias, ataxias, that is a Wernicke's encephalopathies. If there is a Korsakoff's, what they will give you? They will give you the like conflagration. What is conflagration? That is a something which is the like the feeling that gap, that feeling the gap which is the like forget one, जो भूल गया, वो जो चीज भूल गया उसको अपने लाइक फेरी टेल्स, फॉल्स स्टोरी से अपनी खुद को, उसको गेप को फीलिंग करा, दैट इज कन्फ्लाबेशन विच इज कॉर्सेप्टकॉफ. इफ दोनों सिम्टम्स गोवा प्लस कॉर्सेप्टकॉफ, दैट इज गोवा प्लस कन्फ्लाबेशन, दैट वन विल बी द वर्निकेज कॉर्सेप्टकॉफ सिंड्रोम्स, ठीक है. अब इसके अंदर देखो, जेनिटेलर्स, मेलोरी वीज टेल्स, बोरहाव में कैसे डिफरेंशिएट कराऊंगा. इफ देयर इज अ लाइक द बिंज दैट इज ड्रिंकिंग, दोनों में होती है, बोरहाव्स और मेलोरीवीज में, बट देर इज अ रेचिंग और समथिंग लाइक द ब्लड के साथ वॉमिटिंग, एंड द एल्कोहलिक एंड फोर्सफुल वॉमिटिंग, दैट इज द मेलोरीवीज टीयर्स, वेर यू विल सी द टीयर विल बी देयर, बट बोरहाव में ऐसा कुछ भी नहीं मिलेगा ना, द रेचिंग विल नॉट देयर. Yes, and there is a mnemonic which is the Wernicke's encephalopathies, Goa, and the global confusion, ophthalmoplegia, ataxia, and what is the treatment? If there is a Tamil enter plus, there is a, what is the treatment? The thymine, how much gram? Thymine 100 milligram followed by glucose. ग्लूकोज इफ वी विल गिव द बिफोर वन इट विल द वर्सन द सिम्टम्स, है ना, क्योंकि ग्लूकोज का इस इफ दे आर ऑलरेडी हैविंग दैट NADH रेशियो इज इंक्रीज, NADH रेशियो इज ऑलरेडी इंक्रीज, सो in the glucose we will give the later on, they will give you they can give the option in the dextrose 5% or the 10%, ठीक है, 5% or the 10% dextrose 10% they can give, है ना, I mean now there is a patient, ये different, ये like the there is higher chances of asking these questions because this is already asked and repeated in the NEET PG. Difficulty to climbing stairs, इतना ही बहुत है, इतना ही buzzword बहुत है for to like the diagnose this one, the difficulty to climbing stairs and the combing hairs, there is something myositis is there. What kind of myositis? अब देखो heliotrops, that is swelling that is nearby the eyes, that is heliotrops, so it will be the what will be the diagnosis? Dermatomyositis, dermatomyositis, ठीक है. One of the patient I got from the polymyositis where is the autoimmune, और वो औरत चार, that is a woman which is from the 4 years she is on the bed and she developed the bed sore or something and the negative pressure वाली therapy तो वो चलती है उसके, along this one they are the like providing that is steroid only treatment is there, है ना. Sol sign है ना, sol sign, V sign, this is also you will see, but heliotrops generally we like forget that one. Heliotrops, that is a dermatomyositis, that one. Gatron papules, mechanical hands, these are the all like symptoms of the dermatomyositis, है ना. Now there is a important one and why I took this question, this is the simple one, but why I took this one because of the यहाँ पर age matter करती है. 30 years male patient smoker, recurrent oral ulcer and the digital ischemias, there is age which is the like the, if there is a young age, young or the less than 40 age, less than 40, then it's a berger, ठीक है, then it's a berger. If there is a something which is age is the more than 65 years, irrespective of the smoker है या क्या है, you always mark the what, atherosclerosis. तो ये ऐसा गैंग्रीन देख करके, इस तरीके गैंग्रीन देख करके, स्मोकर की हिस्ट्री देख करके बर्जर पे टूट नहीं पड़ना है. फर्स्ट वी नीड टू सी दैट एज कितनी है. अभी इफ देयर इज ए पेशेंट इज यंग देन वी विल मार्क द बर्जर डिजीज वेर इज थ्रोम्बोफ्लेबाइटिस, दैट इज थ्रोम्बोएंजाइटिस ऑब्लिटरेंस, देयर इज अ बर्जर डिजीज, स्मोकर, है ना. इफ देयर इज मोर देन 65 ईयर्स देन एथेरोस्क्लेरोसिस, जरूरी नहीं है एथेरोस्क्लेरोसिस. नाउ एथेरोस्क्लेरोसिस के लिए स्मोकर की हिस्ट्री हो, ठीक है. नाउ देयर इज व्हाट इज द ड्रग ऑफ चॉइस फॉर स्मोकिंग केसेशंस, व्हाट इज द ड्रग ऑफ चॉइस फॉर स्मोकिंग केसेशंस, बताओ डॉक्टर साहब. थैंक यू डॉक्टर तन्मय. स्मोकिंग केसेशन, व्हाट इज द ड्रग ऑफ चॉइस, स्मोकिंग केसेशन ड्रग ऑफ चॉइस. यस दैट इज अ वर्निसिलिन. एक और बता दो, एक और ड्रग्स, दैट इज अ ब्रो पीता है, बुप्रोपियोन्स, दैट इज बुप्रोपियोन्स, है ना. बुप्रोपियोन्स रिप्लेसमेंट थेरेपीज, दैट इज अ निकोटिन पेच और ये सब करते हैं. बुप्रोपियोन्स की जनरली ओपियोइड के साथ में दिक्कत होती है, ठीक है, वो उसमें दूसरा होता है, ब्रो पीता है बुप्रोपियोन्स, है ना. बूपी वेकेन नहीं है, बूपी वेकेन नहीं है डॉक्टर, बूपी वेकेन नहीं है, बूपी वेकेन इज डिफरेंट, दैट आई एम टेलिंग टू यू. ब्रो पीता है बुप्रोपियोन्स, बूपी वेकेन नहीं है. पनिसिलिन एंड द बुप्रोपियोन्स. डॉक्टर आपा, है ना. नेक्स्ट वन 25, दैट माइग्रेटरी जॉइंट पेन्स, इनवॉलंटरी जर्की मूवमेंट्स एंड द फ्यू वीक आफ्टर द सोर थ्रोट के बाद में समथिंग कोरिया लाइक, दैट इज ए इनवॉलंटरी, दैट इज ए. तो यहाँ जर्की मूवमेंट देखते ही कोरिया, तो कोरिया देखते हंटिंगटन कोरिया एक ही याद आता है, बट हियर इज नॉट दैट हंटिंगटन कोरिया, यहाँ पर समथिंग डिफरेंट वन, दे आर गिविंग द सोर थ्रोट, है ना. व्हाट इज नेम ऑफ दैट कोरिया, कोरिया का नाम बताओ. start with the S. Yes, it is a syndemine. सिंडेन हम कोरिया है ना. Syndem Hari Korea, and that is a seen in what? Acute rheumatic fever. Acute rheumatic fever. So that one we need to. No. Huntington chorea, about the Huntington chorea, you need to remember the patient will present with the, of course, will be the hyperkinetic movements. This is, I said 2025 questions. That is November 9 2025 questions. That is a patient present with the what? The chorea like dance like movement, hyperkinetic. Only disorder which is having the hyperkinetic. Like Parkinson बारे में सोचो कि hypo and hyperkinetic दोनों movement मिलेंगे, है ना. बाकी सारे disorder में hyperkinetic, hypokinetic दोनों मिलेंगे. But here will be the only hyperkinetic movements, and which is the what? Which is the Huntington chorea, and Huntington chorea, which is autosomal dominant disorder, which is present on the chromosome number 4, and which is due to the caudate nucleus, atrophy, and where will be the like CAG repeat, and where is drug of choice is tetrabenazines. So that one we need to remember. Yes, Bhuvana. Yes, Jones criteria. Yes, for that one. Ram, aspirin toxicity. Now, middle-aged woman present with the dry eyes, है ना, dry mouth, and the recurrent dental caries, and you can see here is the parotid swelling is there. The swelling is there. Dry eye, the Sika symptom is there. Parotid and the facial swelling is the, you can see, है ना. And there is, you can see that there is something dryness is there, है ना, present with that one. Yes, it's a Sjogren syndrome. There is a Sjogren syndrome. Now this is the confusing with that one, Sjogren syndrome or the 10 syndrome. Okay, if there is a less than 10% involvement, then it's a Sjogren syndrome. It's like 10 to 30% तक, then Sjogren or 10 का दोनों का mix होगा. If there is a more than 30% involvement, then it will be the like the 10 syndrome. 10 syndrome थोड़ा सा खतरनाक होता है. Like see, if there is a 10%, less than 10%, then it's Sjogren syndrome. If there is a 10 to 30, that is a Sjogren syndrome with the 10 syndrome. And then more than 30, there is a 10. There is a definitely 10. What is 10? 10 is a what's the toxic epidermal necrolysis, है ना, necrolysis. And here is the positive. I told you that is, we discussed that anti-Rho SSA, anti-LSA SSB, that is positive, and ocular staining, and we will check that what? The tear and saliva, productions, है ना. But dry है, तो can you tell me there is something we do there, do the test for the dry eyes वाले के लिए, the tear production is which is decreased. Another one thing we need to remember about this one. Yes, this is like the Sjogren's, why I add this syndrome, because of this is already like previously asked, but from the last 3 years they are not asking this one. Yes, it's a smear test. ठीक है, Schimmer test. Steven-Johnson syndrome is different from the Sjogren's syndrome. Sjogren. I am talking about the only Sjogren syndrome. Now, patient present with the like the swelling, solid and liquid, and tight skin over the finger, that is something scleroderma, and the severe reflex symptoms, or you can see here something woody, and there is involving the solid and liquid to difficulty in swelling. So esophagus को भी involve कर लिया, that is something systemic conditions. Systemic sclerosis. Now systemic sclerosis can be the different type of. The scleroderma is the like symptoms, Dr. Tanmay, that is a symptom scleroderma, but there is diagnosis which is the diagnosis which is the systemic sclerosis. It can be the two type of that one, that is the limited one and another one diffuse, limited and diffuse. If there is limited, the formerly it was known as a crash syndrome. Okay, already asked in the NEET piece, so I discussed that one. Limited, the cutaneous limited, that is anti-centromere antibody will be the positive, but in the diffuse one, that one will be the involvement of the more the pulmonary, that involvement will be there. So it will be anti-topoisomerase 1 antibodies and anti-RNA the polyisomerase third antibodies will be there. So that one we need to remember, and this is the what how we will remember. There is a limited one, that is a crash syndromes, and there is a pulmonary hypertensions will be there, but in the diffuse one, no. But in that one, there is the centromere antibodies will be the more prominent in the limited one, but less will be in the diffuse one, and arthritis will be the more likely to the associated with the diffuse one. So that one we need to remember. And the pulmonary fibrosis, what I was talking, the pulmonary fibrosis most likely it will be the diffuse वाले में. So baseline investigation we will start from the chest X-ray वाला, chest X-ray. So we will see the fibrosis और उसके बाद पता चलेगा कि आगे क्या करना है. ठीक है, that is a diffuse and limited one. Okay, so now the patient present with episodic headache, sweating and palpitation, and the proximal hypertension. So एक ये triad है, headache, sweating, palpitation, and in the triad there is a hypertension which is the not a part of this triad. This is the what? Pheochromocytoma. Hypertension which is the not a part of triad. This is generally people used to make the mistakes because it's a proximal hypertensions. Proximal hypertension not a part of triad. So that one we need to remember. And the pheocytochroma, what is the investigation of choice? And here most of people will make the mistakes. That what is the investigation of choice? The pheocytochroma. The VHA level we will check, the 24-hour metanephrine we will check, है ना, that urine, the VMA level क्यों check करते हैं? There is a, like something, ये पूरा pathway, phenylalanine will convert into the that will convert into the tyrosine will convert into dopa will convert into dopamine convert into norepinephrine will convert into epinephrine will convert into the metanephrine will convert into the VMA, vinyl manelic acid. VMA will be the pass through the urine. So that is something which is the pura pathway. Yes, MRI is the investigation of choice. And here is the 3 drugs which is the already asked in that. Now 3 बार से repeat हो गई. There is a pre-operative drug of choice, है ना, intraoperative and the post-operative drug of choice. That one we need to remember. अरे बता रहा हूँ, just pathway. Dr. Tanmay, just relax. Just this is the pathway which we don't need to remember. Gel ball patterns histology. Yes, Dr. Bhuvan. There is a pre-operative which is the phenoxybenzaimine. Intraoperative which is the phentolamine. Post-operative which is the beta blockers. Beta block से याद आया, ब्लॉक तो उसने भी कर दिया था आपको. मजाक कर रहा हूँ भाई. नाउ आगे का क्वेश्चन क्या बन सकता है? यहाँ पर आपने एक चीज देखी, समथिंग विच वी व्हाट ड्रग वी विल गिव. यहाँ पर क्या मिस्टेक्स हुई? द बीटा, there is a BP which is the suit up during the surgery. तो मतलब कौन सी ड्रग नहीं दी गई? दिस ड्रग इंट्राऑपरेटिव वाली ये ड्रग नहीं दी थी, इसलिए during the surgery ये वाली ड्यूरिंग द सर्जरी, दिस इज द लाइक पेंटावलामीन नहीं दी गई थी, दैट्स वाई बीपी इज द सूट अप. नाउ पेशेंट प्रेजेंट विद एपिसोडिक फ्लशिंग, क्वेश्चन यही खत्म हो गया. 29 फ्लशिंग डायरिया, फ्लशिंग डायरिया, ब्रोंकोस्पाज्म, ठीक है, वीजिंग साउंड, ब्रोंकोस्पाज्म. Wheezing sound, flushing, and diarrhea. This is two main buzzword for this one. That is a carcinoid syndrome. कार्सिनोइड के बारे में एक गोल्डन टिप दे देता हूं. कहीं पर भी कार्सिनोइड ट्यूमर है, कार्सिनोइड ट्यूमर्स है, ऑलवेज 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 थिंक अबाउट एपेंडिसाइटिस. एपेंडिसाइटिस. कार्सिनोइड ट्यूमर, एपेंडिसाइटिस. यूरिन 5HE हैया, एंड देयर इज अ फ्लशिंग एंड डायरिया. अगर हैया नहीं भी दिया है ना, फ्लशिंग एंड डायरिया से सोल्व हो जाएगा क्वेश्चन. दैट इज अ कार्सिनोइड सिंड्रोम. Now patient is recurrent fastings, hypoglycemia relieved by the eating, है ना, relieved by the eating और the glucose, है ना. एक बार क्या हुआ कि मैंने ऑफलाइन क्लास में ये बोल दिया था कि हाइपोग्लाइसीमिया विच इज रिवील्ड बाय द ग्लूकोज, उसकी जगह लिख दिया था स्वीट्स लिख दिया था. तो बच्चे बोल रहे हैं कि ये कौन सा ट्रायड है जिसके अंदर स्वीट्स देते हैं. दैट इज स्वीट इज ग्लूकोज भाई. फिनोक्सीबेंजामिन ही तो देते हैं डॉक्टर. यस डॉक्टर. दैट इज समथिंग ट्रायड एंड सिम्टम विच इज इम्प्रूव्ड बाय द ग्लूकोज इनटेक. कौन सा ट्रायड है? विच ट्रायड इज दिस वन? इट इज अ हाइपोग्लाइसीमिया सिम्टम, सीरम ग्लूकोज विल बी द लेस देन, अगर इसका ग्लूकोज चेक करोगे लेस देन 50 मिलीग्राम पर डेसीलीटर, विच विल कन्वर्ट इनटू, दैट इज इंसुलिनोमा. ट्रायड्स का नाम बताओ. इंसुलिनोमा, है ना. इंसुलिन हाई हो गया ना, तभी तो हाइपोग्लाइसीमिया हो रहा है. there is a 100% chances of the either they will ask you the insulinoma, either they will ask you the VIPoma, either they will ask you Zolliger Ellison syndrome. तो ये इन तीनों में से गेस्ट्रिनोमा वाला, तो ये आपको ध्यान रखना है. इन तीनों में से एक पक्का आएगा और तीनों मैंने क्वेश्चन यहीं पे डाल रखे हैं. That is a Whipple's triad. Whipple's triad is seen in, that is seen in insulinoma. Can you tell me where is the, we studied the Whipple's, the surgery? Whipple's surgery. The Whipple's triad which is seen in insulinoma, which is the hypoglycemia. ठीक है, hypoglycemia symptoms and the serum glucose will be the less than 50 deciliters milligram per deciliters, and the that will glucose ingestion will be the symptom relief. Galactoria, visual loss, and the amenorrhea. You will think about the prolactinoma. That is a pancreatic head cancers, periampullary pancreatic cancers or the pancreatic head cancers, है ना. Pancreatic head cancer. Whipple's triad हो गया. The Whipple's, that is a pancreatidectomy, that is a complication which is a treat to a tumors head of the pancreas, bile duct, and small intestine. That one we need to remember. Whipple's processor and the Whipple surgery. Next one, patient present on long-term steroids suddenly develop the vomiting. Long-term steroids, main buzzword for this one. Long-term steroids and the hypotension, abdominal pain, and severe weakness stopping up them after the, there is a medications. Audio is okay now. The main buzzword here, steroid withdrawal plus shock. A crisis. What kind of the crisis? Adrenal crisis. Adrenal crisis. That is adrenal crisis. Next one, bronze skin, pigmentation, diabetes, and the hepatomegaly, which is the most likely diagnosis. What will be the diagnosis? Bronze skin, diabetes, the bronze diabetes, pigmentations, है ना? This is something present on the chromosome number 6. Chromosome number 6. This is due to the iron toxicity, where we do the phlebotomy or the diffruxamine, and that is a diagnosis, which is the hemochromatosis. There is a, like citrus fruit, ascorbic acids, vitamin C are contraindicated this condition. So on the chromosome number 6, chromosome वाले सारे याद रखने हैं, like the chromosome number 3 पे VHL1 hyperlindau syndrome, which is autosomal dominant, CNS lymphoma, and the renal cell carcinoma, that clear cell renal cell carcinoma. 4th पे there is a Huntington chorea. 5th पे familial adenosis polyposis and Cry-Do chat. 6th पे hemochromatosis. 7th पे cystic fibrosis. 7 पे cystic fibrosis, and 9 पे tuberous sclerosis, TSC1 gene, and then another one TSC2 on the 16 वाले पे chromosome number 16 पे. 10 P10 Cowden and red gene, that is on chromosome number 10. 11 पे WT1, that is Wilms tumor or insulin की gene on the chromosome number 11. chromosome 13 पे the patau is a patau, है ना, and the chromosome number 15 that is a Marfan syndromes, and the और कौन सा, that is a Marfan and the Prader-Willi Angelman, and chromosome number 16 abnormalities doesn't exist, but on the TSC2 gene, which is present on the chromosome number 16. 17 पे neurofibromatosis, ठीक है. 18 पे Edward rock bottom foot वाला, ठीक है. And the 21 which is Down syndrome, 22 DiGeorge syndrome, and the 22 also there is a neurofibromatosis type 2, है ना, and 23 which is normal. ये ध्यान रखने. फास्ट चलते हैं ना. Now, question number 33. The teenagers' behavior changes. Something, there is a neurological involvement, tremors, ठीक है, jaundice, and difficulty in the writing. So because of the basal ganglia's lesions is there. Basal ganglia's lesion there. Thank you, Dr. Akiki. Thank you, Dr. Aspirin. ठीक है, this is the KF ring. Okay, KF ring. There is a Wilson disease. KF ring, Wilson disease. और विल्सन क्या है, किसका बेटा? हमारा बेटा. तो विल्सन डिजीज, ATP 7B beta 7B, and the KF ring, and here you can see the what kind of the cataract. That is a sunflower cataract. That is a sunflower cataract. It is a sunflower cataract. There is sunflower cataract, Wilson disease, ATP7B. ATP7A, Menke. Menke is the kinky hairs. There is a lysyl oxidase activity is the decrease due to the copper deficiency. Here is the copper excessive one. Here is the excessive one. That's why we give the penicillamine and zinc one, है ना. Zinc देते हैं इसके अंदर Wilson disease में. And this is the due to the basal ganglia का lesions, and where is you will see the psychiatric symptoms. And what kind of a tremors you will see? The wing batting tremors, flapping wing batting वाले tremors. And this is the psychiatric symptoms will because of that one, because copper deposition can be in the brain, and if liver के अंदर involvement है, then liver cirrhosis, that can be have the liver cirrhosis. If left untreated, then we need the liver transplant also. These kind of the now. Sunflower cataract also seen in the this one. Can you tell me that is snowflake cataract कहाँ मिलता है? snowflake cataract. Snowflake cataract, that is seen in diabetes mellitus because of the deposition of what? Deposition of the sorbitol. Sorbitol का deposition. Oil drop. Oil drop cataract. Oil drop cataract, that is a classical galactosemia. Classical galactosemia. Rosette cataract. Rosette cataract, that is a seen in trauma. कौन सा वाला? Blunt trauma. Blunt trauma. Now blue dot cataract, that is a something torch infection में. Blue dot cataract, that is a torch infection, congenital torch infections. Like the most likely will be the rubella. और rubella के बारे में क्या याद रखना? Greg stride याद रखना. क्या क्या? एक तो blue dot cataract you will see PDA, continuous machinery like murmurs, and the hearing loss, है ना? Sensory hearing loss you will see. That is a three. That is a Greg stride rubella वाला. And rubella is the most common torch infections, congenital torch infections. Sonophylact, that is another one. Christmas tree cataract. Christmas tree cataract, that is a myotonic dystrophy. Myotonic dystrophy. Sixth one. और कौन सा कैटरेक्ट पड़ गया? ब्लू डॉट हो गया, ऑयल ड्रॉप हो गया, स्नोफ्लेक्ट, सनफ्लावर, स्नोफ्लेक्स. सनफ्लावर तो हो ही गया था ना. सनफ्लावर इज अ विल्सन. Myotonic dystrophy. So that one we need to remember about this one. These cataract 100% exam questions they will ask you. Now एक बार अब future MCQs they can ask like in the galactosemia there is oil drop cataract. Galactosemia, oil drop cataract, है ना? तो that is galactosemia, oil drop cataract. What kind of the deposition will be there? Like sorbitol होता है diabetic mellitus, diabetes case में. In that one will be the galactisol. Galactisol will be the in the classical galactosemias. And here is the deficiency कौन सी होगी? Gale-Put की deficiency. Gale-Put deficiency. And the myotonic dystrophy के बारे में most like they will ask you the what kind of the questions, that is Christmas tree cataract and the CTG repeat, and there is the patient will be having the what? Delayed like relaxation, that like eyes को बंद करने को बोला तो वापस खुल धीरे धीरे खुल रही है. So that one will be the myotonic dystrophy के बारे में याद रखना है. Thank you, dog. Thank you. Now, patient present with a watery diarrhea, WD, hypokalemia, H, achlorhydria, WADA, WDHA. 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 वाडा के बारे में बताओ. एक्लोरहाइड्रिया, वादा रहा. और तो बड़े बड़े लोग कौन आगे बड़े कौन होते हैं? वीआईपी और वीआईपीओमा. और बड़े लोग बड़े मतलब इन द पंजाबी दे यूज्ड टू टॉक दैट बड़े लोग, वीआईपी लोग वो आगे बैठते मींस दैट वीआईपी हार्मोन व्हिच इज द लाइक इट विल बी इन फ्रंट ऑफ द like the in the intestine they will like the open that one intestine and वो enterograde जो movement होता है जो NO and the VIPoma that one will be the आगे के side that VIPoma. बड़े लोग. Now there is 35 peptic ulcers, unusual sites and chronic diarrheas, and the serum gastrin level is the elevated. Serum gastric level which is the elevated, that is what? ऊपर आग है, नीचे लाइक हुक्का वाला. आशीष सर ने बता रखा ना हुक्का. there is a hookah, unusual, there is a hookah wala. Peptic ulcers and the diarrhea. Peptic ulcer and diarrhea. There is a gastrinoma. What is a gastrinoma? That is Zolliger-Ellison syndrome. What that will be? The pancreatic and the duodenal tumors will be there, and pancreatic ulcers and the gastric hypersecretion will be there. So that one will be the Zolliger-Ellison syndrome. Zolliger-Ellison syndrome. So that one we need to remember. मल्टीपल अल्सर्स और इससे है ना, यस, ऊपर आग है नीचे पानी है, Zolliger-Ellison syndrome. Next one. There is a something a patient present with recurrent chest pain because of the thick mucus is there, है ना, and there is a steatorias, infertility later in life, and the sweat chloride test which is the elevated. Sweat chloride is elevated. Sweat chloride is elevated. The cystic fibrosis. Can you tell me what is the drug of choice for the cystic fibrosis? And cystic fibrosis which is present on the chromosome number 7, and it's a chloride level which is the like the gold standard for this one, the gold standard for the sweat chloride test we used to do, and there is what more than 60, that or the greater, that is cystic fibrosis. And what is the drug of choice? The drug of choice is what? अब एक आइने सेट का क्वेश्चन बताऊंगा. फर्स्ट ड्रग ऑफ चॉइस विच इज द Ivacaftor. Now the Ivacaftor, that drug of choice, but there is a patient present with already on the Ivacaftor, but yet there is a recurrent upper respiratory tract infection. What drug we will add? This is the INA set questions. What drug we will add? एक मिनट. What drug we will add? Yes, dot 5 not 508 mutation you will see, but upper respiratory tract infection we will add the azithromycin. Now can you tell me what is the mechanism of action of azithromycin? That is 50S. That is 50S inhibitions. That is बड़े लोग macrolides है ना. We will add the azithromycin. That was the questions. Mucolides option में नहीं था. And इसके लिए जीन कौन सी होती है? What is the gene for cystic fibrosis? That is a CFTR gene. CFTR gene. Cystic fibrosis है ना. Cystic fibrosis. क्लेथ्रोमाइसिन, इरिथ्रोमाइसिन और द एजिथ्रोमाइसिन, दीज इन तीनों का 50S इनहिबिशंस, और बाकी जो अमिकासिन और जितने भी ये लाइक क्या बोलते हैं टेट्रासाइक्लिन, डॉक्साइक्लिन, इनका सबका 30S. नाउ 37 नंबर क्वेश्चंस, दैट इज प्रोसिस डिप्लोपिया एंड प्रोक्सिमल मसल वीकनेस इंप्रूव विद द एक्टिविटीज. यहाँ देखती टोसिस देखते ही डायरेक्ट ही नहीं मार देना कि ये तो माइस्थेनिया ग्रेविस ही है. यहाँ पर देखो इंप्रूव विद द एक्टिविटी एंड एब्सेंस द रिफ्लेक्स, दैट इज समथिंग द डिसऑर्डर विच इज नेम स्टार्ट विद द एल. दैट इज बताओ. लैम्बर्ट ईटन सिंड्रोम. Lambert-Eaton syndrome. The ptosis due to the like the third cranial nerve injuries. Okay, cranial nerve third injuries. And ptosis is not a specific one. It can be the seen in. It can be the seen in what? It can be the seen in Horner syndrome. It can be the seen in Pancoast tumors. It can be the seen in myasthenic gravis. It can be seen in Lambert-Eaton syndrome. ठीक है, तो ये ध्यान रखना आपको. Lambert-Eaton syndrome, which is the like the improve the activity and improve with the activity. If worsen with the activity, activities, then it's a myasthenia gravis. And myasthenia gravis, you already know there is eye spec test we used to do, and the hypersensitivity 2 more than 5 है ना, 2 more than 5. And there is a what is a for endorphinium, which is the like the diagnostic drug of choice, and for that that therapeutic one, that treatment के लिए कौन से देते हैं? Pyridostigmine. If there is a myasthenia crisis, then we will give the IV immunoglobulins. ये ध्यान रखना आपको. Improve with the rest and worsen with the activities. एक ही बात है ना डॉक्टर साहब. Yes. Now there is a something that chronic pyogenic infections. ठीक है, pyogenic that is a pyogenic and absent of the tonsil. The male patient है ना, male patient मेल पेशेंट प्लस द पायोजेनिक स्ट्रेप्टोकोकस पायोजेंस का इन्फेक्शन है प्लस टॉन्सिल एब्सेंट एब्सेंट व्हाट टॉन्सिल एब्सेंट tonsil absence and immunoglobulins are the low. There is what? There is absent of mature B cells. What will be the diagnosis? Mature B cells. Yes. And this was question asked in the FMG Jan 2025. It's a Bruton A gamma globulinemia है ना, Bruton A gamma globulinemia. There will be the deficiency of what? BTK gene का mutation, BTK gene mutations. So that was question asked. The BTK gene mutations. Bruton A gamma globulinemia. Yes, doctor. Yes. राम राम जी, निखिल शर्मा सब all good. ADA deficiency, this is already PYQ, FMG PYQ, so SCID, that is a ADA deficiency. SCID and D George, you already know, that is a immature T cells है ना, immature T cells because of the thymus वो हुआ ही नहीं, डेवलप ही नहीं हुआ. Now this one, this is the eczema which is the hallmark for these conditions. Eczema which is the hallmark for these conditions, and patient will present with the recurrent infections and thrombocytopenias, which is the triad of the something which is disorders where is a gene is the WASP gene. WASP gene कहाँ पर मिलती है डॉक्टर साहब बताओ? Where? WASP gene, eczema, infections, low platelets, है ना? Low platelets, eczemas. That is a hallmark for this one. This was INSAID questions. Once one of the like the favorite questions. Yes. 2023 के बाद FMG में नया there is higher chances of the Wiskott-Eldridge syndrome. Wiskott-Eldridge syndrome. So that one we need to remember. Wiskott-Eldridge syndrome. है ना? WASP gene, Wiskott-Eldridge syndrome. Now question number 40, there is jaw claudications, not a arm claudication. Here the common mistake people tends to make the mistakes like the jaw claudications, headache and scalp tenderness, headache, and this is the sudden vision loss है ना, and ESR is the very high. This is something. ये कौन सा पार्ट है? टेम्पोरल एल्डरली पेशेंट्स है, ठीक है, एल्डरली पेशेंट्स प्लस हेडेक एंड द ब्लाइंडनेस का रिस्क है. there is something, there is a giant cell arteritis है ना, giant cell arteritis or temporal arteritis. It's not a Takayasu arteritis. अरे arthritis and arteritis. हाँ, आईने सेट की होते हैं 15-20 क्वेश्चंस होते हैं रिपीट, और सारे क्वेश्चंस मैंने ऑलरेडी सारे नेशनल टेस्ट सीरीज मैंने डाल रखे हैं, जो रिपीट होने हैं वो सारे मैंने डाल रखे हैं ना. Temporal arteritis and Takayasu arteritis, they will give you the like, yes, most specific symptoms for the temporal arteritis, that is jaw claudications. But for the that is a what I am talking, the Takayasu arteritis, that is a pulseless disease, that granulomatous disease, and there is woman present with the what? There is arm claudications, and there is a two different have the like the there is a pressures in the upper extremities, है ना, and arm claudications. That is a Takayasu arteritis. So that one we need to remember. Now मैंने एक बताया था कि there is something, there is a after the बाथ करने के बाद प्रोराइटिक पेन विद गर्म वार्म वाटर से बात करने से प्रोराइटिक पेन, that is a polycythemia vera. But there is एक और है, the burning foot, red swollen extremities, and which is relieved by the cold water. That is a main buzzword, relieved by the cold water. And the burning fit, yes, टेस्ट सीरीज डॉक्टर वही एनएलसी टेस्ट सीरीज में ही, वो कुछ नहीं, वो दैट इज ओनली सर्वर कॉस्ट, दैट इज लाइक द 499. अगर आप बोलोगे आपको देने हैं तो मैं उसको और भी कम मैं कर दूंगा, उसको 299 कर देंगे, डू द 299, है ना, नो वरीज। बट जो टेस्ट लो, टेस्ट दीज टेस्ट आर वेरी वेरी इंपॉर्टेंट वन, वो ऐसे क्यूरेट किए गए हैं लाइक द जितना भी पूरी PYQs का सार है, जितनी भी आईएनएस सेट नीट पीजी एफएमजी के मोस्ट रिपीटेड क्वेश्चंस है, दीज आर इन द टेस्ट सीरीज। यस इट्स अ असेंशियल थ्रोम्बोसाइटोपेनिया नहीं है ना, थ्रोम्बोसाइथीमिया। थ्रोम्बोसाइथीमिया, असेंशियल थ्रोम्बोसाइथीमिया इज असेंशियल थ्रोम्बोसाइथीमिया। नाउ क्वेश्चन नंबर 42. There is a obese patient present with the right upper quadrant pain, fatty meal radiating to the shoulder, and the Murphy sign is positive. Murphy sign is positive. That is mean buzzword. Murphy sign is the positive. And when we check the ultrasound, there is, you can see there is a thickening of the, there is a gallbladder wall. There is thickening of that one. Thickening of the GB wall. That is a acute cholecystitis. That is a acute cholecystitis. Now, can you tell me there is a something another one which is the Murphy eye. Murphy eye, Murphy eye, which is the ET tube. ये ध्यान रखना है। कोलेसिस्टाइटिस, दैट इज कोलेसिस्टाइटिस। एक होता है मर्फी लो होता है, मैं तो इस लो में बिलीव नहीं करता, दैट लो ये कहता है कि मतलब आप पहले से कोई किसी भी चीज़ को बुरा सोच रहे हो कि ऐसा हो सकता है, तो वो होकर के ही रहेगा, दैट इज अ मर्फी लो। बट मैं इसमें बिलीव नहीं रखता, बट मैं इस चीज़ में बिलीव रखता हूँ कि इफ़ वी आर लाइक द, हम खुद में बिलीव नहीं रखें, इफ़ वी आर नॉट बिलीविंग इन अस, देन नो वन कैन लाइक सेव फ्रॉम द लाइक गेटिंग द इन द वर्सन सिचुएशन। So always believe in yourself, always like the always think in the positive way, क्योंकि पॉजिटिव वे करेंगे तो ब्रेन को पता नहीं कि आप मजाक कर रहे हो या क्या डिफ्रेंशिएट कर रहे हो। पॉजिटिव करोगे तो आप योर ब्रेन सेल्स विल वर्क, योर एक्शंस विल बी कन्वर्ट इनटू दिस वन, है ना। तो ऑलवेज थिंक पॉजिटिव। नाउ देयर इज 2-3 टर्म्स है जो याद रखनी है आपको। देयर इज समथिंग कोले लिथियासिस। व्हाट इज अ कोले लिथियासिस and what sign you will see in the cholelithiasis? There is a cholecystitis, है ना। Another one, there is something syndrome which is a Mirigy syndrome. Mirigy syndromes. Another one, choledocholithiasis. What is this one, है ना। एक होता है कोलेडोकल सिस्ट। आपके कभी जीवन में कभी कोई दिक्कत नहीं आएगी अगर आपने ये समझ लिया, है ना। एंड द कोलेडोकल सिस्ट हो गया, कोलेडोकल सिस्ट। अनदर वन कैरोली डिजीज, कैरोली डिजीज। अनदर वन कोलेंजाइटिस। 100% एग्जाम क्वेश्चन, अभी स्क्रीनशॉट ले लो, 100% एग्जाम क्वेश्चन इसमें से, है ना, कोलेंजाइटिस। और एक है गॉल स्टोन इलियस, ठीक है। नाउ वी आर डिस्कसिंग हियर लाइक दिस इज द लीवर, इसके लीवर की लेफ्ट हिपेटिक डक्ट, राइट हिपेटिक डक्ट, दे मेक द कॉमन हिपेटिक डक्ट, एंड देर इज समथिंग cystic duct which is the duct which is the supply from the gall bladders, and this is the common bile duct, ठीक है, CBD। अब सारी दिक्कतें यहाँ से शुरू होती है, देखो। एंड बाकी वाली तो CBC वगैरह वो देख लिया था, ठीक है। यस करेक्ट, रोहित खेतावत। नाउ देर इज समथिंग स्टोन इधर है कि स्टोन इन द gall bladder. If there is a stone in the gall bladder, then this is the cholelithiasis. Where is the cholelithiasis? Which is, what does mean? That is cholelithiasis, and what kind of sign you will see? That is a stone which is in the gall bladder, and that is a cholelithiasis, where you will see the Mercedes Benz sign. Mercedes Benz sign. मर्सिडीज बेंज साइन। तो इसको कैसे याद रखोगे, बेंज जो मर्सिडीज होती है वो कैसे चलती है, पत्थरों पे चलती है, मर्सिडीज पत्थरों पे चलती है। सो दैट इज अ मर्सिडीज बेंज साइन। कोलेलिथियासिस, ना कोलेसिस्टाइटिस वी ऑलरेडी डिस्कस, दैट इज अ मर्फी साइन, दैट इज मर्फी साइन। Now, cholelithiasis क्या क्वेश्चन आ सकता है, on the ultrasound it will be the differentiate between the gallstone and the gallstone and gall polyp. In the ultrasound, that is gallstone, you will see the what, acoustic shadow, acoustic shadow. But in the gall polyp, no acoustic shadow. Okay, no acoustic shadow. So that one we need to remember. Cholelithiasis, ठीक है. Now this is the stone which is the, if there is a something stone which is here, and this is the like the that call, there is a gall, that gallbladder cholelithiasis. If this is stone implemented here, then here will be the lots of the bacterial infections. तो ये करवाएंगे, that will cause their what, they will affect this wall, and that will be the double layers, that wall, the wall is the thickened wall, that is a the cholecystitis, that is a cholecystitis where is Murphy sign is positive. Murphy sign means the inspiratory, सांस लेने को बोलते हैं तो 15 मिनट के बाद वो हो जाता है, ठीक है. So that one we need to remember. Don't go in the depth part. So this stone, if it is there cystic duct, then it will be like having the so much infection in the gallbladder, that is a cholecystitis. Now अगर ये stone, if there is a chronic infection रहा, if there is so many times there is stone, then this stone will be the goes into the like the with the ectopic रास्ते से यहाँ पे stone आ गया in the स्मॉल बाउल में, इन द स्मॉल बाउल, दैट इज ड्यूडियोनम ना, दैट इज स्मॉल बाउल में आ गया, देन बहुत सारे स्टोन हो गए दैट इंप्लीमेंटेड. सो स्मॉल बाउल ऑब्स्ट्रक्शन, दिट इज अ नीट पीजी क्वेश्चन, नीट पीजी 2024 क्वेश्चंस. स्मॉल बाउल ऑब्स्ट्रक्शंस, स्मॉल बाउल ऑब्स्ट्रक्शंस, एंड ये गोल स्टोन कहाँ है, एक्टोपिक है या अपनी जगह पे ही, दैट इज एक्टोपिक. सो एक्टोपिक गोल स्टोन, और ये एयर will be there, so it will be pneumobilia. What is the name of this triad? This name of triad is known as a ringler triad. ringler triad, ये ध्यान रखना आपको, ठीक है, ringler triad. So that one we need to remember. This stone ये यहाँ से फोड़ के यहाँ पे आ गया, that is in the ectopic part. In the ectopic, the small bowel obstruction you will see, that ectopic gallstone you will see, and also pneumobilia, that is a ringler triads, which is the seen in gallstone ileus, which is the what is diagnosis, that is a gallstone ileus. So that one we need to remember, ringler triads, ठीक है. Now this stone, अगर ये stone, if this is the stone which is the coming here, and this is that like blocking this one, cystic duct को block कर दिया, hepatic duct को block कर दिया, that is what, that is a Merijie syndrome. So Merijie syndrome में कहाँ पर आएगा, that is stone which is the blocking what, cystic duct and the common hepatic duct, not common bile duct, that is a Merijie syndrome. Now choledocholithiasis means something that is stone यहाँ पे आ गया, stone come here, that is a choledocholithiasis. Now choledocholithiasis बार बार रहेगा तो यहाँ से bile आ नहीं जाएगा, bile आ नहीं पाएगा, that will not goes the downside, and then it will be like the having the pressure that upstairs, that is above side, that means it will create the charcot triad. Charcot triad में क्या आएगा, the patient will having the infection होगा, fever होगा, and that pressure will be there, so right upper quadrant pain, fever, and the jaundice, that is charcot triad, which is the seen in cholangitis, that is a cholangitis, है ना. So ये ध्यान रखना. Now इस pressure आएगा तो ये that one irritate that is this wall, and this one will be the like the affect this one wall, and they will create the something the diverticulum here. यहाँ पर कुछ पस करके यहाँ पर diverticula कर दिया, तो कोलोडोकल diverticula बाद में cyst बन गया. After that is a choledochal cyst, and after that one there is a classification which is name known as a Todani classification, which is already neat PG questions. In the Todani classification, तो अभी मैं जो बात कर रहा था वो Todani classification की बात कर रहा था. Classification, in the Todani classification there is a type 1, 2, 3, 4 and the 5. We need to remember only 3 and 4. First you will see the like that, that's something that is a infection of that one, that is a common bile duct infections, and then in the third you will see the choledochal cyst. in the type, in the that is a type 3, and type 4, type 5 you will see the Caroli disease. Caroli disease, it is something affecting one. So टोडानी classification कभी आ जाए तो ये मत भूलना, ठीक है. So colorectal cyst is already done. There is a Caroli disease which is the type 5 called Todani classification, and cholangitis which is the right Charcot triads, and gallstone ileus which we discuss. So that one we need to remember. Okay, so this is the very important one, और ये आपको ध्यान रखने हैं, ठीक है, ये आपको ध्यान रखने हैं. Okay, now coming to the next one. Patient present with the fever, night sweat, weight loss, and painless cervical lymphadenopathies. Cervical lymphadenopathies and alcohol-induced pain. Alcohol-induced pain, that is a mean buzzword for this one, and that is something lymphoma. What kind of the lymphoma is this one? Weight loss, painless, cervical lymphadenopathies, night sweat, fever. कौन सा है? That is a cells which is present here. That there is a bluish. There is a bluish one. RS cells. That is a present in the what? बताओ. That is a Hodgkin's lymphoma. That is a Hodgkin's lymphoma. So that one we need to remember. Hodgkin's lymphoma. साइटोमेगलोवायरस आउलाइस एंड साइटोमेगलोवायरस के बारे में आपको दो तीन चीज ध्यान रखनी है. एक तो इट विल बी लाइक द इट्स अफेक्ट व्हाट साइटोमेगलोवायरस. इट्स लाइक द मोस्ट लाइकली इट विल कोज द अल्सर विल कोज, and it will be like most likely implemented with the like the kidney transplant wale. But there you need to see if there is a something history of what. If history is more than 6 months, then kidney transplant, the kidney transplant, then is a cytomegalovirus is okay. If there is less than 2 months, then it's BK virus, then it is a BK virus. Less than 2 months, more than 6 months, cytomegalovirus, kidney transplant है ना. So that one we need to remember. Next one, the patient developed the hemoptysis, hematuria, and the rapid worsening of the renal failure. Rapid worsening of the renal failure. Hematuria, hemoptysis, that is one. बताओ, what is the diagnosis? Lung and kidney both are involvement. Lung and kidney both are involvement. Okay, I am giving it another hint. That is a hypersensitivity type 2 anti basement antibody is the present. Collagen defect type 4. अब तो बताओ यार, collagen type defect 4, and also complication it's a थायोमा है ना. It's a good posture syndrome. So that one we need to remember. Linear IgA. Renal. Yes. Next, 45. The patient present with amenorrhea, acne, and the excessive facials. ये तो important one है ना. What is the full form of that PMOS? प्रधानमंत्री Ovulation Stimulation योजना. The menstrual irregularities, hirsutism is there, है ना. तो मैंने पूछा था कि in the once in the class I asked what is the initial management of this one PMS PCOS है ना. So there is a string pulse of appearance is present, a rotandom criteria we use for this one, the PMS. Nowadays PMS they are talking about this one. तो उसने बोला what we will do, तो सर के फर्स्ट थ्रेडिंग करवाएंगे, एक्सेसियल फेशियल हेयर हो गया ना. फर्स्ट इन द इनिशियल ट्रीटमेंट इज द लाइफस्टाइल मॉडिफिकेशन. दैट इज अ लाइफस्टाइल मॉडिफिकेशन. पीएमएस पॉली एंडोक्राइन मेटाबॉलिक ओवेरियन सिंड्रोम है ना. पॉली एंडोक्राइन मेटाबॉलिक ओवेरियन सिंड्रोम, नॉट ए प्रधानमंत्री ओवुलेशन स्टिमुलेशन योजना. Now, resting tremors, mask-like faces, and the shuffling gaits. What is the diagnosis here? What is the diagnosis here? What is the diagnosis here? अरे रितेश क्यों करवाएगा? रितेश तो लड़की थोड़ी ना जो सिस्ट बन गई. पार्किंसन डिजीज, मास्क लाइक फेसेस, हाइपोमीमिया एंड माइक्रोग्राफिया. हाइपोमीमिया मतलब स्मॉल स्लो वॉइस, एंड द माइक्रोग्राफिया मतलब हैंड राइटिंग इज वेरी लो, है ना, वो मतलब छोटी छोटी हैंड राइटिंग, इतना छोटा छोटा लिखेगा. माइक्रोग्राफिया एंड द हाइपोमीमिया. 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 गेट होगा, एंड देर विल यू विल सी द रेस्टिंग ट्रेमर्स विल बी देयर, है ना. मास्क फेसेस, फेस सारी याद रखने आपको. फ्रॉग फेसेस, दैट इज अ जीएनए. मास्क लाइक फेसेस, दैट इज पार्किंसन डिजीज. देयर इज समथिंग व्हिच इज द लाइक द डोल लाइक फेसेस, दैट इज अ वॉन क्रिकेट डिजीज, है ना. वॉन क्रिकेट डिजीज. फ्लैट फेसेस, दैट इज डाउन सिंड्रोम. So Parkinson disease, it is like the having disease in the substantia nigra, and there is a pale and degenerated one. Neuronal losses you will see. Parkinson disease. Next one, the memory loss, nor with the pressures, the progressive memory loss and the urinary incontinence. Urinary incontinence. Dr. Akhil, there is how many questions? There are 50 questions is left. 50 questions is left. Either we will do in the part 2, if you tired, we'll do the in the part 2, है ना, if you tired. Urinary incontinence, memory loss, progressive memory loss, gait disturbance. Urinary incontinence, gait disturbance. That is a NPH, normal pressure hydrocephalus, vaxiplexy, है ना. Weight, wobbly gait, vaxiplexy. Okay. Okay. NPH, NPS. Okay, Doctor Yes Sharma, you will do NPS. नेक्स्ट वन, द चाइल्ड प्रेजेंट विद बार्किंग कफ. ठीक है, बार्किंग कफ, ड्रूलिंग एंड ट्राइपोड पोजीशन और द फ्रॉग पोजीशन. ट्राइपोड पोजीशन और द फ्रॉग पोजीशन, दैट इज अ acute epiglottitis. Yes, doc, we will continue. If you are ready with that one, we will continue. That is acute epiglottitis. Acute epiglottitis, what is the most common cause? That is streptococcus pneumoniae, more than H influenza, because H influenza nowadays are the vaccine is there, है ना. दिस इज द थंब साइन, थंब प्रिंट साइनिंग, ये लेटरल नेक पे थंब साइन, थंब प्रिंट साइनिंग, दैट इज अ इस्चेमिक कोलाइटिस. थैंक्स. तो acute epiglottitis, streptococcus pneumoniae, and epiglottitis, where is you will see the stridors, है ना, respiratory distress and the स्ट्रेप्टोकोकस न्यूमोनिया के बारे में सारी बात होगी. नाउ पेशेंट 49, एपिसोडिक वर्टिगो टिनिटस विच इज द फर्स्ट साइन, एंड द hearing loss and the ear is the fullness. What is the diagnosis? And when you will check the audiogram, you will see the something upsloping. So upsloping audiograph, and the vertigo tinnitus and hearing loss, that is a what, that is what, that is what, just disease बताओ. Yes, that is a Meniere's disease. That is a Meniere's disease. That is a Meniere's disease. So that one we need to remember. Okay, Dr. Devas. Meniere's. Upsloping. अब एक तो था upsloping audiograph, and there is another one which is the downsloping. Which is the downsloping. Downsloping कौन सा होता है? Downsloping. और इसमें हिस्ट्री होगी, there will elderly patients. Elderly patients. They will give you something elderly patients history. Downsloping, that is a presbycusis. Yes. Okay. Race biases. Everything is okay, na? ठीक है, ठीक है. Acoustic neuroma is not there. Acoustic neuroma, you need to remember this one is the like the this one. This is due to the compression of the eighth nerve compressions where you will sensory hearing loss, ice cream cone appearance, Hitzel-Berger signs, and they will give you the history of the like 30 to 60 years का age group होगा, है ना? Hitzel-Berger sign, acoustic neuromas. Yes. अच्छा क्लियर लिखूं क्या मैं इसको? सॉरी यार. रेस बाइकोसिस, ठीक है. Now this one 50. There is a moon faces central obesity purple stria. Central obesity is purple strias. Cushing syndrome, है ना? That is a most like diagnosis. That is a Cushing syndrome. Cushing syndrome. Cushing syndrome. Central obesities यही ध्यान रखना है. And this same question asked in FMG Jain 2021. अरे सॉरी भाई माफ कर दो डॉक्टर आर के. Because of handwriting because there is a like less times and when you will be in the hospital you will forget the good handwriting. My notes is good because that time I used to study ना. Nowadays ओपीडी में ऐसे चलता है, पीसीएम ऐसे पी और सी वहाँ बाहर जाता है, एम पूरा प्रिस्क्रिप्शन से बाहर चला जाता है. बफेलो हम्प ओबेसिटीज कार्डियक हाइपरट्रोफीज, ठीक है. दैट इज एंड द ऑस्टियोपोरोसिस मून फेसेस एंड पर्पल ऑन स्ट्राया, दैट पर्पल, है ना. लेमन ऑन स्ट्रिंग, पर्पल स्ट्राया, सेंट्रल ओबेसिटी दीज. नाउ क्वेश्चन नंबर 51. असेंडिंग वीकनेस. असेंडिंग वीकनेस आते एक ही चीज के बारे में सोचोगे. एंड डायरिया आफ्टर द 2 वीक विद एब्सेंट रिफ्लेक्स विच इज द इन्फेक्शन ऑफ द व्हाट? कैम्पाइलोबैक्टर जेजुनी का इन्फेक्शन. कैम्पाइलोबैक्टर जेजुनी इन्फेक्शंस एंड द असेंडिंग वीकनेस आफ्टर द डायरिया. पोस्ट इन्फेक्शियस असेंडिंग पैरालिसिस. पोस्ट असेंडिंग पैरालिसिस. कैम्पाइलोबैक्टर और जीजा कैसा? जीजा का टेम्परेचर हमेशा हाई रहता है, 42 डिग्री बेस्ट टेम्परेचर 42 डिग्री, है ना. 42 डिग्री बेस्ट. दैट इज जीबीएस गुलियन बेरी सिंड्रोम. गुलियन बेरी सिंड्रोम असेंडिंग नीचे से ऊपर तक, बाकी सारे डिसेंडिंग वन, बाकी सारे डिसेंडिंग. दैट इज गुलियन बेरी सिंड्रोम जीजा. और लिस्टीरिया का टेम्परेचर क्या है? हाउ यू विल रिमेंबर लिस्टीरिया? लिस्ट तो लिस्ट बनाते हैं, लिस्ट किसके लिए? दारू पीने के लिए. और दारू को कब कितने डिग्री टेम्परेचर पे स्टोर किया जाता है? दैट इज 4 डिग्री. 4 डिग्री पे 4 डिग्री. तो दारू क्यों बोला? दारू मीन्स लिस्टीरिया हैव द व्हाट काइंड ऑफ मोर्टिलिटी? दैट इज अ टम्बलिंग मोर्टिलिटी. टम्बलिंग मोर्टिलिटी. दैट इज अ टम्बलिंग मोर्टिलिटी लिस्टीरिया 4 डिग्री, है ना. 4 डिग्री टम्बलिंग मोर्टिलिटी लिस्टीरिया. सो दैट वन वी नीड टू रिमेंबर अबाउट दिस वन. 4 डिग्री लिस्टीरिया टम्बलिंग मोर्टिलिटी. कैम्पाइलोबैक्टर जेजुनी 42 डिग्री GBS syndrome. Next one, there is a fatigue pruritus, there is jaundice and history of the ulcerative colitis. Ulcerative colitis के साथ में कौन सा association है? And MRCP shows the multifocal biliary structures which is the string of pulse appearance, something like string of pulse appearance. Ulcerative colitis के साथ में associated UG, associated with the UC. Ulcerative colitis and this is the MRCP. It's the only diagnostic one. It's a diagnostic one, but this is the like you can see this one is the like endoscope आ रहा है, so it's a ERCP. ERCP. What is the difference between MRCP and ERCP? ERCP is diagnostic plus therapeutic, है ना. diagnostic plus therapeutic, but MRCP it's only MRI ना. It's MRI non ionizing. It's a what? Primary sclerosing cholangitis and which is associated with ulcerative colitis. Ulcerative colitis साथ PSC है ना, ये ध्यान रखना. Next one 53. The drooping eyelids and evening, and difficulty in chewing the food after the prolonged meal. Eye spec test is positive. यहाँ पर आपका बोलो that is a myasthenia gravis. That is a myasthenia gravis. इवनिंग में वर्सन हो रहा है ना, symptom which is the worsening in the evening. That we already discussed multiple time myasthenia gravis. Now drugs से एक बार ध्यान रखना, डायग्नोस्टिक के लिए एंड्रोफोनियम है ना, एंड्रोफोनियम for the treatment. There is a therapeutic one. For the treatment we do the pyridostigmine. And for the crisis, myasthenia crisis, there is a IVIG है ना, IVIG myasthenia gravis. Now 52, there is 54, there is a episodes of the fasting hypoglycemia, hepatomegaly, and the protuberant. There is a abdomen and dole-like faces. There is a dole-like faces. Dole-like faces and the growth retardation. Laboratory diagnosis that lactic acidosis. तो जहाँ पर भी severe hypoglycemia plus lactic acidosis, you will think about the one disorder, that is only that one. Severe hypoglycemia, I am telling you, because कोरी में भी ऐसा ही होता है, hypoglycemia lactic acidosis मिलेगा है ना, that can be there, but there will be the no severe hypoglycemia है ना, that is a one गिरके, and it's due to the what? Deficiency of what? Deficiency of what? एंजाइम का नाम बताओ. Now glycogen storage disorder के बारे में सारी पे चीजें बता रखनी है. There is glycogen storage 0, there is glycogen synthase, there is a deficiency of glycogen synthase, glucose 6 phosphate deficiency that can lead to one गिर के, glucose 6 phosphate deficiency, glucose 6 phosphate deficiency can lead to the one गिर के disease, where you can see there like the hepatomegaly, and there is a severe hypoglycemia, lactic acidosis, dole-like faces, you will see. Second is the Pompe was asked in FMG Gen 2026, don't miss it. This is all related to the hearts, like failure of the heart, high cardiac outputs है ना, and the cardiomegaly, ठीक है, dilated cardiomegaly, and the dilated cardiomegaly, there is a Pompe disease, acid maltase है ना, acid maltase is deficient. Third one is the Cori, which is the Cori debranching, that is enzyme deficient. And the fourth one, Anderson, which is early age death, and where is the branching enzyme deficient. Fifth one is the McArdle, where is the muscle glycogen phosphorylase is deficient, where is the patient will be having the like the fatigueness after the exercise, है ना, fatigueness after the exercise. And seventh one, that is sixth one is the Hirsch disease, where is the that is a hepatic one. And seventh one is the Taury. There is a ये थोड़ा सा मिस हो जाता है. That is a Taury. It is due to the phosphofructokinase 1 deficient. Phosphofructokinase 1 deficient, which is the rate limiting enzyme of what? Glycolysis का rate limiting enzyme क्या? Phosphofructokinase, and that is a Taury disease. And this one will be the present with the, like the hemolytic anemias, hypoglycemia, and the that is a glycolysis वाले symptoms. Sorry, Taury 7 is a type 7. So that one we need to remember. I'll send you that PDF, है ना. Now difficulty in the swelling, solid food followed by the liquid. यहाँ पर भी ऐसे इस तरीके से है, and there is solid food followed by the dysphagia, more than solid, more than liquid solid से मतलब liquid से ज़्यादा solid में dysphagia, that is something. And red tail appearance, what is that one? That is esophageal. And how you will differentiate between the like the esophageal carcinoma between the that achalasia cardia? There is something bigger hint you will see. If it is a dysphagia, है ना, dysphagia solid more than liquid, then it's esophageal carcinoma. If there is a dysphagia liquid more than solid, then it is a achalasia cardia. And achalasia cardia main reason is that it's due to the what? It's due to the like the failure of the LEC, lower effector spectral relaxation, failure of the LEC relaxation, and that one will be there. So what we will do, the treatment, that is a Heller myotomy. Heller myotomy we do for the achalasia cardia, where you will see the bird beak appearance, barium on the barium swallow, bird beak appearance है ना, liquid more than solid, achalasia cardia. Yes, correct डॉक्टर साहब. Abbas Fahim. Okay, good. Not in that is a red tail. एक और होता है रेट बाइट इरोजन्स. कहाँ पढ़ा था? वेयर वी स्टडीड रेट बाइट इरोजन्स. रेट बाइट इरोजन्स कहाँ पढ़ा था? वेयर वी स्टडीड रेट बाइट इरोजन्स. Something podagra, red bite erosions, hyperuricemic conditions, and patient will be having the like the first, it will be the like the involvement of the first metatarsals, and they will give you the history of the businessmen, or the like who is the intaking that is the so much protein diets, or the क्या बोलते इसको, eating more non-veg diet. There is a gout rat bite erosions, वहाँ पर मिलता है rat bite erosion. That one we need to remember. Now, peritibial edemas, massive proteinurias, and frothy urines after the viral illness. The blood pressure is the normal. What is the diagnosis here? In the 56? Okay, giving you the hint here. The child is in the child most common is the child में that is a frothy urines है ना, frothy urines है, मतलब not cola color urine, तो it's a nephrotic. ठीक है, nephrotic. PYQs, not PYQs, Dr. RK, this is the PYTs है ना. Yes, most common in the children, that is a minimal change disease, and there is a nephropathy, means it's a nephrotic syndrome. Next one, 57, the development facial deviations, inability to close the eyes, and the close the eyes means ye bhi affected, and the one side drooling of that mouth, there is a to the exposures. There is a lower motor neuron lesions is there, and what is that one? Facial palsy is also involvement of that one, and the yes, both sides. Is GD नहीं है. This is minimal change disease. Children. Yes, it's what? Yes, it's a Bell's palsy. It's Bell's palsy. So that one we need to remember. Now, the patient present with proximal muscle weakness, bone pain, and welding gait. यहाँ से ऐसा लग रहा है कि something that is something DMD के जैसा लग रहा है. But here is you can see the lab shows the low vitamin D, and there is age नहीं दे रखी, and proximal muscle weakness that is seen in what? That is can be the osteomalacia, because of vitamin D is the deficient ना. Can be the rickets, can be the, but most likely it will be the welding gait के साथ osteomalacia. In the rickets they will give you something that going of legs, craniotabes, or the something frontal bruising, that ये वाला part ज़्यादा हो गया. Then Harrison sulcus you will see, and there is a sternum tenderness के साथ में, that one will be like the ricketsy rosary. कैसी होगी? Non painful, non sharp, and non tender will be there. और opposite में किस में होती है? स्कर्वी में the scorbutic rosary, वहाँ पर होगी painful, sharp, and the tender. So this is osteomalacia. Now ये see, देखो यहाँ पर something rate bite erosions हुआ, and the MTP, first MTP joints, and alcohol की बींज की साथ में, and needle that is a revealed, that is a needle shape is there. Needle shape क्यों? It will be the differentiate between the gout and the pseudo gout. The pseudo gout में you will see that most common site is that one knee, and another one that is a what? It will be the rhombic shape. Rhombic shape होगा, and that one will be in the what? Pseudo gout. यहाँ पर है gout. This is the gouty arthritis. It can be the acute, can be the chronic. In the acute, most likely the patient present आता ही नहीं है, ठीक है. That is a sometime in the, if they come with the like gouty arthritis, because of the, in the gouty arthritis we, that is drug of choice with NSAIDs, and the colchicine also give, colchicine most likely we give in the refractory periods, है ना, refractory gouty arthritis. And the chronic we give the allopurinols. If patient have the allergy to the allopurinols, we will give the febuxostate. Both have the mechanism, that is xanthine oxidase inhibitor, which is example of the competitive inhibitors, है ना, competitive inhibitors. It's a negatively bifurcates and needle shape, the gout, pseudo gout, positive bifurcates, and that is a not a, that is a uric acid का deposition, that is a calcium pyrophosphate का deposition, that is a pseudo gout. तो वो आपको ध्यान रखना है. Next one, 62, that is bloody diarrhea, the bloody diarrhea, abdominal pain, weight loss, and the painful parent fistula. Main hint, fistula associated with the Crohn's disease or the there is a ulcerative colitis. और यहाँ पर देखो cobblestone appearance, है ना, cobblestone appearance fistula के साथ में, and oral ulcer, that is ophthalmos ulcers के साथ में, bloody diarrhea, and rectum is a sparing. Rectum is sparing. That is a what disease? That is a Crohn's disease. Yes, great guys. Pseudogout, we will do the different kind of the treatment, not these hyperuricemic drugs. कैल्शियम पायरोफॉस्फेट और द क्या बोलते हैं नी का इन्वॉल्वमेंट है वहाँ. Crohn's disease. If there is a something pseudo polyp के साथ association, then ulcerative colitis. Fistula है ना, the fistula is the main buzzword for the ulcerative colitis, है ना. Now there is child who is present with a sudden severe respiratory distress after the choking while eating the peanuts. The breathless, there is a breath sound is reduced in the one side. That is a something what? Foreign body aspiration. Foreign body aspiration. Or foreign sudden choking के episodes, foreign body aspirations, and that one we do the Heimlich maneuvers or the कौन सा देते हैं back and slap. Heimlich maneuvers, ठीक है. Heimlich maneuvers, there is a what is criteria? If there is a age is more than 1 year, then we do the Heimlich maneuver. If there is age is the less than 1 year, then we will do the back and slap. That one we need to remember. हाँ, Crohn's में fistula. Akhil Reddy, Dr. Akhil Reddy, there is a Crohn's fistula and the pseudo polyps in the ulcerative colitis. Yes. Because उसका size बड़ा होता है. Dr. Tanmay, size is बड़ा. That is a right bronchus, most common site. Yes, maneuver. This is the main things which is we need to remember. Foreign body. अगर foreign body nose में है तो foreign body in the like nose. If there is atrophic rhinitis, there will be the merciful anosmia. वहाँ पर जहाँ patient will present like उसको तो foul smelling आ ही नहीं रही, only examiner doctors को आ रही कि foul smelling आ रही. There is a merciful anosmia, there is a roomy nose, merciful anosmia, there is atrophic rhinitis where we do the modified Young operations, है ना, modified Young operation. But there is a foreign body in the nose, there will be foul smelling. Patient will complain that कि मेरे को बहुत गंदी smell आ रही है, foul smelling. वो merciful anosmia नहीं हुआ. That will be the anosmia. That is a foul smelling. That is a patient know and also observer that doctor know. That is a foreign body, है ना. That is a foul smelling वाला. ध्यान रखना आपको. अरे नहीं pseudo polyp, the fistula, ulcerative, that is a Crohn's disease, polyp, pseudo polyp, ulcerative colitis, and also toxic megacolon. Ulcerative colitis. This one things we need to remember. Cousina, merciful anosmia, that is all the atrophic rhinitis. Now 62, patient present with the progressive exertional dyspnea, dry cough, and the bibasal and inspiratory crackles, bibasal and inspiratory crackles, and the clubbing is present. Clubbing can be the present in the can be the any kind of disorder where is the lungs are the like the lungs are the involved. तो यहाँ पर क्या होगा 62 we discuss that one. Dyspnea, external and dry coughs, that is something pulmonary का क्या pulmonary fibrosis. Now question to you, that is a which drug cause the pulmonary fibrosis. Pulmonary fibrosis के drugs के example बताओ जितने भी सारे. C से नाम बताओ, A से नाम बताओ, M से नाम बताओ and another one N से नाम बताओ. ठीक है. Pulmonary fibrosis, yes, pulmonary fibrosis का क्या बताओ, there is a carmostine, amiodarone, M से methotrexate, N से nitrocuratoin. Now amiodarone के another side effect we need to remember, and another one B से नाम बताओ, bleomycin, another one busulfan, है ना, busulfan. Amiodarones के side effect, there is a 3 side effect we need to remember because this is the FMG Jan 2025 questions. Hypothyroidism and the pulmonary fibrosis. Hyperthyroidism and pulmonary fibrosis, that is amiodarones के, ठीक है, side effect. Another one blue main वाला methotrexate side effect, that is a methotrexate pulmonary fibrosis. That's why that question ionized questions, there is a methotrexate को start करने से पहले baseline treatment क्या करेंगे, always there is a risk of the pulmonary fibrosis, we will do the chest x-ray. What is the mechanism of action of that methotrexate? That is a block the dihydrotet that DHTR है ना, dihydrotetra reductase, that is inhibition at the what, it's inhibit the DNA synthesis at the what phase, S phase ध्यान रखना, ठीक है, S phase. Yes, hypo and hyperthyroidism both side effect of the amiodarone. This is the FMG Jan 2025 question. Okay doctor साहब. Next one 63, present with hematuria, hypertension and pre-orbital edemas and urine so the RBC cards. Most likely type of the syndrome, nephrotic or nephritic? It's a nephritic, है ना, nephritic. Yes. And in the what is antidote we give in the methotrexate? We give the folinic acids or leucovorin, है ना. The folinic acid active is the folinic acid which we give, है ना. S phase, that one we need to remember. It's a nephritic. Generalized edema, frothy urines, not cola color urines. Frothy urines, hypoalbuminemia, proteinuria, hyperlipidemia. That is a nephrotic syndrome. Easy questions है, but sometimes people tends to make the mistakes in the. तो ये ध्यान रखना. Next one, patient present with sinusitis, hemoptysis, hematuria, C ANCA is positive, and I told you यहाँ पर saddle nose present, C ANCA positive. That is कौन सा disorder? Wegener's granulomatis. That one we need to. Hemoptysis, sinusitis, hematurias, lungs or kidney is also involvement. Lungs, kidney, sinus, these are involved. That is Wegener's granulomatis. Next one 66, there is a woman which is the fever, arthalgia, photosensitivity and a recurrent abortion. While I was talking about this one, जब मैं बात कर रहा था इसके बारे में, जब हमने शुरुआत की थी एंटीबॉडीज के बारे में, recurrent abortion and APTT, that is a antiphospholipid syndrome. हाँ, रिकेट्स में तो चाइल्ड की हिस्ट्री देंगे। एंटी फॉस्फोलिपिड्स, प्रोलॉन्ग एपिडिट एंड रिकरेंट अबॉर्शन। एक और बात याद रखना, इन्फेक्शन इज नॉट ए लाइक द देयर इज नॉट ए cause for the recurrent abortion. Okay, this is the main line. Infection is not a cause for the recurrent abortion. Next one, intense fear, palpitations, sweatings, chest tightness and the fear of dying, impending dooms, last 20 to 30. I am want to only one thing, that is it's a panic disorders or panic attack, है ना? Panic disorders or panic attack, impending doom, impending doom, panic, मरने, ऐसा लग रहा है मरने, बट देर इज एब्सेंट ऑफ व्हाट, डायरेक्ट डिसऑर्डर नहीं, डॉक्टर रितेश, देर इज अ ह्यूज मिस्टेक्स, disorders there is a, they will give in the panic disorders, they will give you the history of what, history of more than 1 month, है ना? They will give you the history of the more than 1 month. Panic attack, uh, first we will do the propanolol देते हैं, ठीक है, उससे थोड़ी सी इसकी वो, बाकी ऐसा सारा ही another things will the like the reduce the stressor one and all, वो ध्यान रखना आपको. Impending doom, panic attacks, fear of dying, impending doom. But here the main things which we need to remember, another one, that is here suicidal thought will be the absent. Okay, the suicidal thought absent, suicidal thought will be the, yes dog, yes. But the drug which we give the propanolol, why we give the propanolol, because you know the propanolol which is the like uh, which will be the decrease the anxieties, है ना? Yes, yes. Next one, 68, the confusion, tremors, agitations, visual hallucination, autonomic instabilities 2 days after stopping of the alcohols. 2 days means कितने दिन हो, कितने हो गए, 24 48, 48 hours, 48 hours. What will be the like the diagnosis, delirium tremens. Okay, and most first कौन से होने वाले होंगे, that will be the tremors. अरे डॉक्टर अमित जांगरा, that is a continuous lesions will be in the that is ulcerative colitis, and skip lesion will be in the Crohn's disease. Delirium tremors, delirium tremors, delirium tremors. Next one, vomiting, tinnitus, tachypnea, and mixed respiratory alkalosis and metabolic acidosis after the overdose. Something that is a drugs which she took, and there is a tinnitus and acid base का mix आ गया है. The drugs का overdose plus acid base mix, that is a something poisoning की बात कर रहे हैं. कौन सी वाली poisoning की बात कर रहे हैं, बताओ नाम, salicylate or the aspirin. That is aspirin poisoning, that is aspirin poisoning. Okay, that one we need to remember. Salicylate, aspirin poisoning. Opioid poisoning, they will give you respiratory distress, ठीक है, respiratory distress and the constipations, इस तरीके की हिस्ट्री they will give you, है ना? Next one is very very important. Farmer present salivation, lacrimation and urination, diarrhea, meiosis and the muscle fasciculation after the pesticides exposure. Farmer pesticides, अपना famous वाला sludge वाला mnemonic, that is a organophosphate poisoning. Organophosphate poisoning, ठीक है, organophosphate poisoning. And what is the there is a antidote of choice is that is a atropine, which is obtained from Atropa belladonna, atropine plus oximes, pralidox में, है ना, oximes. But always remember, this is the NEET PG ionized questions. This is ionized question. The oximes which is are the given the first we will give the oximes, then we will give the atropine. And this question I gave in the national test series. people made the mistakes in that one. Atropines ले गया क्या? They're okay. And where we will avoid this one? Where we will avoid? This one. ऑक्साइम्स कहाँ पे अवॉइड करें? कार्बामेट पॉइजनिंग में वी विल अवॉइड दिस वन, है ना. कार्बामेट्स में ओनली वी विल गिव द एट्रोपिन्स, एंड एट्रोपिन ऑब्टेन्स फ्रॉम द this one, atropa belladonna. And if there is any kind of the atropine की poisoning, then what we will give? Organophosphate नहीं देंगे. atropine poisoning होगी, then we will give the phyostigmine. datura poisoning, phyostigmine. ठीक है. नियोस्टिगमिन कहाँ देंगे? कोबरा की पॉइजनिंग, कोबरा के बाइट में ना, कोबरा बाइट में. कार्बामेट ओनली वी विल गिव द एट्रोपिन. ओके डॉक्टर साहब. The patient presents with amenorrhea, galactorrhea, headache, and the pent, that is visual loss, temporal hemianopia. Where is the samoma body is present. Samoma body is present. Galactorrhea, visual defect, है ना. What is the diagnosis? And what drug we will give? Prolactinoma. And what is for the prolactinoma? What is the drug of choice? There is a bromocriptine and the cabergoline. Cabergolines. Cabergolines. Samoma bodies. Next one, 34 week that present with headache, visual symptoms, hypertension and proteinurias, but there is no seizures. This is the what? This is a typical case of what? Pre-eclampsia. Why it's not eclampsia? Because of the seizures is not there. If seizure is not there, then we need to give that one, that is magnesium sulfate, because of this neurostabilizers. Pregnancy 34 week की है ना, headache, which there is a headache और ये. Now newborn develop the vomiting, lethargy and seizures and the mousy musty odors, and when you will check the hairs, it is like something albinism वाले hairs. There is a blonde hair. IQ is the decreased, है ना. Mousy musty odors, lethargy and the vomiting is there. एक मिनट. Mousy musty, phenylketonuria, that is a PKU. Mousy musty odor. Alkaptonuria नहीं होगा. Alkaptonuria, there is a different one. Alkaptonuria वहाँ पर ochronosis, joint arthritis, that one will be there, and which urine which is that is a change into the this one black when the exposure to the oxygen. That is alkaptonuria, है ना. Now hair से related कितने भी ये सारे आपको याद रखने. Hair से related, the blonde hair, that is a phenylketonuria, or it can be the albinism. But albinism में क्या होगा? That IQ will be the normal, but in the phenylketonuria, there will be the like the blonde hairs, but IQ will be the decrease. And there is the kinky hairs, there is a Menke kinky hairs, that is a Menke disease. And another one, that flag hair किसमें मिलता है? क्वासी और का sugar baby syndrome, protein deficiency, ठीक है, sugar baby syndromes, sugar baby syndrome. एंड दूसरा और क्या याद रखना आपको? That is sugar baby syndrome, flag hairs, corkscrew hairs, that is this one. Ascorbic acid, vitamin C deficiency. ये वाला we already discussed this one. Renal stone, hematuria, hearing loss, and the family history is that kidney is disease. And here you can see the basket view pattern appearance on the electron microscope. Basket view pattern acclimatization, not alopecia areata, that is a trichotillomania, है ना? The basket view pattern appearance, electron microscope, and this one need PG questions. Ophthalmic defect in this condition. There is an anterior lenticulus. A ophthalmic defect, that is anterior lenticulus electron microscope basket view pattern appearance, and type 4, and that is a Alport syndrome. That is a Alport syndrome, type 4 collagen defect, anterior lenticulus hematurias. अच्छा, ये 74 छूट गया क्या डॉक्टर? then I will tell you. Now 74 वाला बता दूं. Meconium pass, abdominal distensions and chronic constipations. Something chronic constipation because of this one. Rectum is the empty. Rectum is the empty. This is the due to the what? This is the due to the rat gene loss of function. Loss of the function, rat gene, loss of the function, rat genes. Okay, and this is the due to the loss of normal hostration. Normal hostrations. There is a, what is the diagnosis here? And what is the gold standard for this one? This disease के लिए what is the gold standard? हर्स्प्रंग डिजीज है ना, हर्स्प्रंग डिजीज. रेड करंट जेली स्पूल यहाँ पर नहीं, वो इंटू सबसे में डॉक्टर जेनी. And here is a rectal need PG FMG question. Rectal biopsy, which is the gold standard. Gold standard है ना, हर्स्प्रंग डिजीज. If gain of the red gene, gain of the function of red gene, that can lead to the what? By MEN2A, MEN2B. Okay, MEN2, MEN syndrome. Here is the red gene loss of the function, not a gain of function. ठीक है, नेक्स्ट वन 76 ब्रॉन्ज स्किन. ठीक है, लो बीपी, हाइपोनेट्रीमिया एंड द हाइपरकेलेमिया. हाइपरकेलेमिया, potassium is the so much high, sodium is the low, and the BP is the hypotension. Skin pigmentations, always think about one disorders, that is a Dr. Dhanush, that is a medullary carcinoma which is associated with the like the MEN2A, MEN2B, and which is the like the medullary carcinoma which is the also associated with amyloidosis, and where is the also there is a calcitonin is the marker for that conditions. Chromosome number 10. This is एडिशन डिजीज, ये ध्यान रखना, एडिशन डिजीज है ना. हाइपरपिगमेंटेशन, इलेक्ट्रोलाइट इम्बैलेंस. कैसा इलेक्ट्रोलाइट इम्बैलेंस? दिस इज 100% एग्जाम क्वेश्चंस. पोटेशियम विल बी द हाई, सोडियम विल बी द हाइपोनेट्रीमिया, पोटेशियम विल बी द हाई एंड बीपी विल बी द लो. एडिशन डिजीज है ना, एडिशन डिजीज. Next one, sudden chest pain, shortness of breath after the prolonged immobilization, and the ECG shows the sinus tachycardia. है ना, sinus tachycardia means something that P wave is present. P wave is present. S, and in the ECG pattern you will see the S1, Q3, and the T3. Okay, S1, Q3, T3, and here in the chest X-ray you will see the something hump is there. Something hump is there. What is name of this hump? That Hampton hump is present. This one, another one, S1Q3 patterns. There is a, what is the name of this disorders? Name of disorders. Deep S wave in the one. Sinus है ये sinus है always check from the lead 2. But in the S1, that is a deep S1. And in the Q3 देखो, Q and the T, which is the prominent one. T. Pulmonary embolism. This is the what? Pulmonary embolism. So that one we need to remember. Main clue, what they will give you, the immobilizations and the sudden dyspnea. Immobilization and sudden dyspnea. Yes, great. Now थोड़े से रह गए, जल्दी करते हैं. Recurrent fractures, bowing of the leg and the failure to thrive. Bowing of leg देखते हैं, rickets पे टूट नहीं पड़ना, but here you see that vitamin D is a normal, so it's something which is the resistance form. Resistance form of what? There is a vitamin D resistant rickets. Thank you so much, Medlink Consultancy. Yes. Vitamin D resistance rickets. Vitamin D. इसका दूसरा ऑप्शन में क्या दे सकते हैं? What they can give in the different options? Hypophosphatemic rickets है ना? Hypophosphatemic rickets. Hypophosphatemic rickets, vitamin D resistance, and the vitamin D. And if there will be the rickets one will be there, the bowing of legs, like the wind shape deformity can be there. उसमें से, और the Genoverum or valgus, there is valgus will be there, and there is a ping pong ball, है ना, craniotapes, the widening of the sutures, there is a frontal bruising and the Harrison sulcus, ये सारे symptoms मिलेंगे. Next 79, the child present delayed coarse faces, hepatomegaly, joints stiffness, skeletal deformities. A patient also having the corneal clouding. That is a main hint. ऊपर से ऐसा लग रहा है कि हंटर भी हो सकता है, हर्लर भी हो सकता है, नवजाकी भी हो सकता है, कुछ भी हो सकता है. बट नीचे आकर देखो, दैट इज कॉर्नियल क्लाउडिंग एंड इंक्रीज द यूरिनरी, देयर इज अ यूरिनरी ग्लाइकोसामिन ग्लाइकन्स, हिपेरान और डर्मेटांस. Hiperan or dermatans, there is a ping pong ball effect. मतलब ping pong means there is a widening of the suture, तो suture proper तरीके से वो joints नहीं हुए, जो fibrous joint होता है ना, जो sutures का होता है fibrous joints, that one not fully developed that much, तो उसकी वजह से that is a something, that is a वो ऐसे कि दब जाता है, that is ping pong ball type में, craniotapes. This is a hunter और hurler. This is a एक तो होता है hurler, एक होता है हंटर. हर्लर समथिंग नो, हर्लर अल्फा एल आई डू नी डेज एंजाइम डेफिशिएंसी है ना. एंड हियर आइडोरिनेस deficiency. In the hurler or hunter, which one is the X-linked recessive? X-linked recessive hunter. Hurler is the autosomal recessive. Okay, and hurler have the, in the hunter we need that there is aggressive moods, and or that is X-linked recessive, तो कुल्हाड़ी लेके रखता है, तो they will have the aggressive moods and they need the sharp vision, so there will be the no corneal clouding है ना, no corneal clouding. No corneal clouding. Hurler have the coarse faces, also hunter have the coarse faces, but it will be there है ना. Hunter, X-linked recessive. So that one we need to remember. Here is the diagnosis, the Hurler, alpha L iduronase, or Hunter direct there is a direct दारू पीता है तो iduronase direct, and here is Hurler में L है तो it will be the Hurler L, there is iduronase alpha L है ना, alpha L, ये ध्यान रखना. Next one, 80, present with a sudden painful loss of the vision, red eyes, painful, and halos around. This is the main buzzword for this one. Halos around the lights. What kind of the glaucoma it's a? Acute angle closure glaucoma. There is a painful vision loss. Open angle, it will be the painless, है ना? Crow, the CRAO, it will be the painless. But this is the painful vision loss. There is CMV retinitis, there is CD count less than 50, which is the painful, है ना? Or also there is a like pain while either like मैं जब अपनी eyeballs को movement कर रहा हूँ, there is a pain, which is the optic neuritis, which is associated with multiple sclerosis, है ना? ये ध्यान रखना, multiple sclerosis. Drug of choice, ankle closure glaucoma, that is pilocarpines, and the open angle glaucoma, there is a latanoprost, and latanoprost का mechanism of action क्या है? That is uveosacral outflow को increase करना. So how you remember? उल्टा लेटा दिया latanoprost, है ना? उल्टा लेटा दिया. Next one, 81, patient present with a fever, rash, hypotension, conjunctival, there is a congestions, and squamous palms and sole, and tampon use. The tampon use का बताओ. Tampon use, the main buzzword for the NEET PG PYQ. Tampon use बताओ. With toxic, the shock plus rash, hypotension है ना, shock plus rash, that is a toxic shock syndrome. Tampon use, toxic shock syndrome. That one we need to remember. Okay, Doksa, great. 82, rest tremors, coriform movements, and the mood changes and family history similar to the illness. What is the most like diagnosis? आपका, हमारा, तुम्हारा, सबका फेवरेट autosomal dominant कोरिया, हंटिंगटन कोरिया, है ना? ये caused by the step warriors. ये तो हो गया, ठीक है. 82 पे बताओ. 82 हंटिंगटन कोरिया, hyperkinetic movement, what is drug of choice? There is a tetrabenazines, Huntington chorea, autosomal dominant है ना, autosomal dominant है, and there is a nucleus and it's a chromosome number 4, autosomal dominant, chromosome number 4, and the coded nucleus पे there is a palsy है ना. 83, recurrent pulmonary infections and situs inversion inferiority later after the life because of the primary ciliary dyskinesia, PCD, primary ciliary dyskinesia, and pulmonary sinopulmonary infection because of that mucus is not going outside and वहाँ infection plug हो गया, this वजह से infection हो रहा है वहाँ पे. Situs inversus, बताओ what is this one? Recurrent infection, situs inversus. The name which is start with the K syndrome. What is the name of that one? Carter what? Jenner syndrome. Carter-Jenner syndrome. So that one we need to remember. 84. Child present with sore throat, cervical lymphadenopathy is thick grayish mass. There is a white pseudomembrane over the tonsil which bleed and attempted to removal. A patient also developed the myocarditis and the neuropathies. What is the most like diagnosis? Yes. Correct, guys. Correct. All great. Myocarditis, which is the complications, and the pseudomembrane, which is the pseudomembrane, which is the bleed, which is the when we remove the removal on the bleed, and this is the what? Diphtheria. Where what kind of the diphtheria, where you will see the what, you will see the what, bullseye, the bull's neck, not eye, bull's neck lesions. And the on the Albert Einstein you will see the Chinese letter pattern or cuneiform pattern appearance, and lobular serum slope. There is a media for this one, and potassium tellurite agar we use for the that is a diphtheria. Diphtheria के लिए कौन सी agar use करते हैं? पोटेशियम टेलराइट agars है ना, पोटेशियम टेलराइट agar, lobular serum slope, and that is a Albert Einstein. And another one, that one we need to remember about the diphtheria, there is a drug of choice erythromycin. Drug of choice याद रखना है ना, drug of choice erythromycin, not erythromycin. Erythromycin. Myocarditis is complications for the diphtheria, and it's caused by the Corynebacterium diphtheria, which is Albert Einstein and all we use. है ना, Chinese letter pattern. Yes, yes, Dr. Ritesh. 85 weight loss despite of the eating well, heat intolerance, sweating tremors, and the atrial fibrillation. This is the most likely diagnosis of what we already discussed. This is the multiple time hyperthyroidism है ना, hyperthyroidism. And I told you the hyperthyroidism, मेरे यहाँ क्वेश्चन देने का मकसद ये था कि that atrial fibrillation which is associated with the hyperthyroidism, not a hypothyroidism. So that one we need to remember. Yes, doc. Yes. Drug of choice is erythromycin. Now the patient 86, there is a fever, conjunctivitis, cough, coryza, conjunctivitis, whitish spots. That is a, what is name of that spots? That is name of spots is, that is a poplite spots. Oblique spots, and they are the like spots generally we don't like see because of that patient present after the like the race आ जाते हैं उसके बाद में ना, oblique spots. अच्छा, measles, and measles को हिंदी में क्या बोलते हैं? खसरा. And another name of measles, that is German, that is a measles का another name क्या है? rubeola. That is a rubeola. Oblique spots, measles, cough, coryza, conjunctivitis, है ना. Next one is very very important one, the prolonged high grade fevers, abdominal discomfort, relative bradycardia. First that buzzword for this one, relative bradycardia, constipation followed by diarrhea, examination they find the salmon colored that maculopapular races, and the trunk, and that is a rose spots है ना, rose spots trunk है ना, rose spots. Rose spot, longitudinal ulcers, there is a typhoid. And it's caused by the Salmonella typhimurium. ठीक है, Salmonella typhi, and it's like the how we will differentiate between the Salmonella and the Shigella, we will do by the jet. There is a from the Wilson Blair media, in the Wilson Blair media which is showing the jet black colonies, it's shown by the Salmonella, Shigella nahi. And both Salmonella, Shigella is non-lactose fermenter bacteria. Typhoid, where is the like step-ladder fever, the relative bradycardia, rose spots, and the step-ladder fevers हो गया, ठीक है. And longitudinal ulcer, that one we need to remember. और इसमें कौन सा डायरिया होता है? व्हाट काइंड ऑफ डायरिया यू विल सी, दैट इज अ स्पेसिफिक द नेम ऑफ डायरिया, दैट पी सूप डायरिया, that is a pea soup diarrhea. So that one we need to remember. Next one, 88. Great guys. 88, that is a 88 young oval salmon color, that is a herald patch है ना, herald patch. And the day after that is a multiple, that is smaller erythematous scaly lesions and distributed which along with the skin cleavage, and the trunk in the Christmas tree appearance. The Christmas tree appearance बताओ, Christmas tree appearance. Christmas tree cataract कहाँ था? Myotonic dystrophy. Christmas disease, that is a fact, that is a hemophilia B वाला जो factor 9 absent होता है जिसमें. Inverted fir tree different. Inverted fir tree medusa colonies, that is a Bacillus anthrax wala. Yes, it's a Pityriasis rosea. It's a Pityriasis rosea. Pityriasis rosea. That one we need to remember. Next one, 89. Rescued house fire development headache confusions and dyspnea severe lactic acidosis bright red color venous blood. ऊपर से ऐसा लग रहा है जैसे कोई सीओ की पॉइजनिंग हुई है, बट हियर सी bitter almond and bright red cherry venous blood, that is something having the different history. ऊपर से ऐसा लग रहा है कि जैसे फायर लगी है कोई बंद कमरे में, दैट इज कार्बन मोनोऑक्साइड की पॉइजनिंग, बट दिस इज नॉट ए कार्बन मोनोऑक्साइड पॉइजनिंग. द ब्राइट cherry red, not a spots, that is a bright red color venous blood, that is, and almond bitter almond, that is something poisoning. कौन सी poisoning? Which poisoning is this one? That is a cyanide poisoning, inhibiting the what complex of the etc. H2S will be not there. H2S तो क्या होता है? H2S में तो you will see the what kind of pattern, that rotten fish smell. This is bitter almond. That is cyanide में complex 4, that is a etc complex 4 blocked by the cyanide हो गया, H2S हो गया, CO हो गया, है ना, by them. And the complex 1, which is the like NADH dehydrogenase, NADH dehydrogenase, which is the one which is by inhibiting by which one? Complex number 1, 2, 3, 4 है ना. The complex number 1, which is the NADH dehydrogenase, second is succinate dehydrogenase, third one is the like the cytochrome reductase, and fourth one is cytochrome oxidase, and fifth one is the ATP synthase. The complex number 1 rotenone, yes, rotenone में 1 आ रहा है, rotenone 1, 2 से second inhibitor कौन है? Yeah, phenobarbital is also complex number 1 inhibitor. 3 तो antimycin है, 3 is antimycin, fourth is the like the H2S CO and the cyanide वाला, fifth one is the oligomycin वाला, that oligomycin. Second बताओ. Antimycin is the 3, second. Yes, maltase नहीं, malonate. There is a malonate. And TTF and malonate. Next one, the question number 90, that is recurrent pneumonia, eczema, coarse faces, and retained the primary teeth and elevated the IgE, hyper IgE. That is a Job syndrome. That one we need to remember. Next one, the patient present with the dark urine in the morning and the recurrent thrombosis and pain cytopenia. There is a most likely diagnosis will be the what? Diagnosis. यहाँ पर मैं थोड़ी सी हिंट दे देता हूँ. मॉर्निंग, दैट इज मॉर्निंग डार्क यूरिन इन द मॉर्निंग, ठीक है, रिकरेंट थ्रोम्बोसिस एंड थ्रोम्बोसाइटोपिनिया, एंड हियर इज द पिगा जीन का म्यूटेशन, एंड दिस इज FMG Jan 2026 क्वेश्चन. They ask the drug of choice of this condition, the piga gene mutation. Last time I discussed with these questions, I start from this questions discussion. Last time एक ऐसा सेशन लिया था जैसे 1 घंटे का था, उसमें से 5 क्वेश्चंस आए थे, तो 100% आपके से इन सेशंस में से देयर विल कम लाइक 25 to 30 क्वेश्चन. पिगा जीन म्यूटेशंस, CD55-59 deficiency, 55-59 deficiency. Yes, this is the PNS. ठीक है, proximal nocturnal hemoglobinuria. And what is the drug of choice here? The drug of choice is the eculizumab. ये ध्यान रखना आपको. 92, there is fever, arthalgia, hematuria purpura, ठीक है, and upper respiratory tract infection. This is a typical PYQ. पर palpable purpuras है, there hematuria, arthalias, there pain के साथ patient present, there is a HSP, ये ध्यान रखना है. Palpable purpura plus renal का involvement. Renal का involvement is there because of the hematuria is there. Dr. Vikas, there is a CO poisoning. CO poisoning में they will give you like the cherry red spots. Okay, they will not give you the bitter almond. They will not give you the bitter almond. This is HSP, anoscoline purpura. And what is another name they can give? That is they can give the IgA vasculitis. IgA vasculitis. Next one, 93. That is patient present with the like the vertigo, long-lasting second trigger, and why it is turning to the head, no hearing loss. What is the diagnosis here? It's a BPPV, and BPPV have the two main words. That is a one for the diagnosis, one for the treatment. For the there is a if there is a treatment something पाँच से क्या आता है? And ABCDE 5. There is a apply maneuver. There is a apply maneuver for the treatment. For diagnosis में D आ रहा ना, so Dix all like Dixol pipe, that is diagnosis. So this one is the for the diagnosis, and this is the 5. 1, 2, 3 and 4, 5. That is a for the treatment. So apply maneuver for the treatment. 5 treatment. that one is a Dixol pipe. That is a diagnosis. 94. फीमेल विद द वेट गेन के साथ में मेंस्ट्रुअल इरेगुलरिटीज, कोल्ड इंटॉलरेंस, डिलेड द टेंडन रिफ्लेक्स, टीएससी इज इन्वॉल्वमेंट. दैट इज समथिंग दे आर टॉकिंग अबाउट द हाइपोथायरॉइडिज्म ना, hypothyroidism, and here you can see the, please appreciate this one. This one is the something Hurthal cell, which is the positive in the Hashimoto hypothyroidism. Hurthal cells, Hashimoto thyroiditis है ना. 95. The progressive dyspnea, dry cough, hilar bihilar lymphadenopathies. Erythema nodosum is the present, and on the gallium 67, you will see the what kind of sign? There is a panda sign. On the X-ray, you will see the garland sign on the X-ray. What is diagnosis in 95? Diagnosis that CD4, that CD8 ratio is the increase in these conditions. And another one, AS level will be the increase. AS level is increased, CD4, CD8 ratio is increased, AS level is increased. And another one, what kind of the granuloma is this one? Non-caseating granuloma. This is something, sorry, sarcoid. It is a sarcoidosis. That one we need to remember. Sarcoidosis, panda sign and garland signs, and CD4 ratios and S level will be the increase. This is the 100% exam questions. Don't forget this one. The sarcoidosis is very very important one. अब तो थोड़ी सी रह गई, थोड़ी सी हिम्मत कर लो है ना. मेरी तो ड्यूटी है यार, फिर भी मैं कर रहा हूँ ना अभी आधे घंटे में. Non-caseating. Next, 96. Patient present with a fevers, severe muscle pain, especially in the calf tenderness, jaundice, and the conjunctival suffusion, and after the water flood exposures. Conjunctival suffusion, that is a main buzzword for this one. Okay. And there is 3R is there. Rat, ran, and the rice paddy field. What is the diagnosis here after the flood? Leptospira. Leptospirus. Dr. Akhil Reddy, that is a Shepherd, which is Shepherd cuff deformity, which is fibrous dysplasia मिलता है, यहाँ पर नहीं है ना, not here. This shepherd cup deformity, the fibrous dysplasia, which is the disorder of the that is the diaphysis, and also it is associated with McCune-Albright syndrome. 97. The child present with the easy bruising, recurrent bleeding, joints, and the family history is the maternal uncle. There is something history दे रखी कुछ ऐसा maternal uncle के साथ में. The bleeding into the joints, bleeding into the joints. और फोटो दे दे नी की. Hemarthrosis. That is a FMG Gen 2026 का PYDs है. Hemarthrosis, recurrent blood, that bleeding into the joints. That is a hemophilia A. That is a hemophilia A. Now present with a rapidly progressive 98. Yes, Dr. Saab, yes. बताओ ना, factor 8. Factor 9 is Christmas one. 98. Rapidly progressive dementia, myoclonus, and a periodic sharp wave on the EEG. Okay, hint देता हूँ यहाँ पर. Something cortical ribbing is there, है ना, ribbing हो रही है, and there is something contaminated beef खा लिया, raw beef खा लिया. This disorder can be the infectious, can be the hereditary. Once a time, Dr. Ashish sir that posted this question. Cortical ribbing, there is a progressive, that is dementia. It can be the sporadic, can be the familial, can be this that inhibitory, that is can be the hereditary, can be the infectious one. Yes, this is the Prions disease. The Prions disease. Creutzfeldt-Jacobs disease है ना. Main buzzword this one, the rapidly progressive dementia. Rapidly progressive dementia. ठीक है डॉक्टर. ओके डॉक्टर. Next 99. Episodic wheezing, that a recurrent flattening, that pulmonary infiltration, eosinophilia, and the brownish mucus plug. यहाँ से ऊपर से ऐसा लग रहा है कि समथिंग दैट इज वीजिंग, एपिसोडिक वीजिंग, अस्थमा लग रहा है, एंड दैट इज पल्मोनरी इन्फिल्ट्रेशन आया, यूसिनोफिलिया, समथिंग फंगल इन्फेक्शन, समथिंग फंगल इन्फेक्शन, यहाँ से अस्थमा. ठीक है, ब्राउनिश म्यूकस प्लग हो रहा है, अस्थमा, यूसिनोफिलिया, म्यूकस प्लग. There is something disorder which is the name start with the ABPA. What is ABPA? Allergic bronchopulmonary aspergillosis. Aspergillosis. Okay. Aspergillosis. Aspergillus nigers. Okay, doctor. Now last questions. स्पून नेल. ठीक है, अगर मैं ये नहीं भी देता ना तो भी आप ये कर लेते. स्पून नेल मतलब कोइलोनेकिया, एंड कोइलोनेकिया दैट इज अ सीन इन आयरन डेफिशिएंसी एनीमियास. एंड हियर यू कैन सी व्हेन यू लुक एट हियर इसोफेज, यहाँ पे एक वेब बन गया, तो इसोफेजियल वेब, एंड द फटिगनेस, dysphagia due to the this one esophageal wave. There is something disorders, dysphagia, iron deficiency anemias, microcytic hypochromic anemias, pencil cell, spoon koilonikias, progressive, that one, that plumber, Vinson syndrome. Plummer-Vinson syndrome. So that one we need to remember about this one. Plummer-Vinson syndrome. This is the 100% exam question. So this one we discuss about these 100 clinical topics, and which hope this will work for you. And I know you guys interacted and you know all the things, and you like the did the like the in the great way. लाइक द आपने एफर्ट्स मारे इतने, लाइक द वी आर स्टैंडिंग हियर लाइक द फ्रॉम द लास्ट सिंस 3 3.5 घंटे से बैठे हुए हैं ना यहाँ पे। तो ये सब आपका स्ट्रगल है, दिस इज योर लाइक स्ट्रगल्स एंड एफर्ट्स विच यू आर पुटिंग फॉर द टुमारोज, एंड दीज आर द गोल्डन डेज, एंड दैट वन विल बी लाइक कि भाई इस तरीके से आपके आगे, दैट वन विल बी लाइक द हेल्प इन द लाइक आगे जब आप जीवन में कभी भी आगे बढ़ोगे, दैट वन दीज डेज विल बी द हेल्प फॉर यू। तो ऑलवेज रिमेंबर, ऑलवेज रिमेंबर कि आपने जो स्ट्रगल मारा, आपने जो स्ट्रगल किया इस टाइम पे, दैट इज द लाइक द मेकिंग द एफर्ट्स, लाइक नो वन इज हियरिंग यू, नो वन इज सपोर्टिंग यू, बट स्टिल यू आर मेकिंग द एफर्ट्स टू लाइक द टू लाइक द यहाँ से निकले बाहर। इसके लिए ऑलवेज 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 लाइक द लाइक कीप वर्किंग हार्ड, ठीक है। और कुछ नहीं, वर्किंग हार्ड, कोई भी कुछ भी बोलता है हेड डाउन करो और सुनो। मेरे को भी कोई बोलता है, ठीक है, मेरे को भी कोई कुछ भी बोलता है, मैं किसी की नहीं सुनता, कि मेरे को क्या कोई रोटी देने वाला थोड़ी ना है। मैं अपना काम कर रहा हूँ, अपना एफर्ट मारता हूँ, आप अपने एफर्ट मारो, ठीक है। एंड मैं हमेशा आपके लिए प्रेयर करूंगा, मैं ऑलवेज आई विल प्रेयर फॉर यू फॉर द गुड रिजल्ट, एंड विल मीट एंड विल आई विल कम विद द लाइक द मोर सेशंस, बट आई नीड कि भाई आप पास हो जाओ बहुत अच्छे मार्क्स से, दैट वन विल बी द ग्रेटफुल फॉर मी, है ना। एंड तो मेरे मैं लास्ट के अंतिम शब्दों में द फाइनल एक्ट ऑफ लव आई विल टेल यू, आदित्यन एक दिन सब बदल जाएगा। सिट, ओके, एवरीथिंग इज ओके। सो आदित्यन एक दिन सब बदल जाएगा, तुझे ढूंढते ढूंढते काफिला आएगा, शर्त यह है कि तुझको, आदित्यन एक दिन सब बदल जाएगा, तुझे ढूंढते ढूंढते काफिला आएगा, शर्त यह है कि तुझको रहना पड़ेगा, जो कहता आया वो कहना पड़ेगा, तुझ पर कोई भरोसा करे ना करे, तू ठान ले तू रुकेगा नहीं, तू तय करेगा तू चल पड़ेगा, आदित्यन एक दिन सब बदल जाएगा, है ना। एंड ऑलवेज ऑलवेज ग्रेटफुल एंड लव यू सो मच एंड विल सी यू, है ना। अरे चलता रहता है। मैं शरारती इंसान हूँ। यस यस, थैंक यू सो मच, थैंक यू सो मच, विल सी यू अगेन। बाय बाय, बाय 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 बाय। ओके गाइस। थैंक यू।